Did you adjust the temperature, Jake? Okay.
Thank you for reminding me. So 75 sound good?
Yep, that's good. Thank you. All right, good morning. This is the halfway point. Goes quick, doesn't it? Goes really quick. Okay, so between last class and this class, you guys had chapter 4, and I know chapter 4 is dense. There's a lot of information in there. When I call your name, if you can tell me either how many you missed or what your score was, if you did, if you used the grading scale to figure out your score, either one is fine. Veronica?
I got 3 wrong.
Okay, thank you. And do you have chapter 2 and 3 for me?
I do.
What'd you get on those two? It'll be page 182 and 183.
I got 3 wrong and then 2 wrong.
Thank you. Deslin?
0.
Thank you. Hannah?
I got 2 wrong.
Thank you. Sylvia? Chelsea? Nevaeh? Cynthia? Thank you. Okay. All right. So, does anybody have any questions on what you read in chapter 4? Does anybody have any questions on that chapter? The questions that you missed, do you know why you missed those? Why the right answers were the right answers? You will have some questions on the state exam about changes in aging, normal changes in aging. So that pink worksheet that I handed out, that will help you kind of understand those things that you need to know. Good? Okay. So we're going to do a quick review before we get into today's lessons. And the last hour of today is going to be all about registering for the state exam. We're going to give you the paperwork. We're going to go through it step by step so you know what to put where in the application. You're going to understand the entire testing process, how long it takes, and the steps that are involved. So there's a lot to go over after skills today before we end. So in order to perform skills, we have to know what we need to do. We don't get to go in and just decide what that patient needs. That's not our role here. CNAs follow the care plan. But they don't just follow the care plan, they follow the whole care plan, which means they can't pick and choose the parts they want to follow. And nothing but the care plan, which means they can't add to it. Now, this is going to be important on the state exam because the questions are going to be written in a very specific way to try to trick you into making those decisions, into adding something in. If your brain says, but if, stop. That if does not apply. You're adding something to that question that does not exist. Good. If your brain says, well, that doesn't make sense, I'm going to do it a different way, stop. That is not in your scope of practice. So if the care plan tells you to perform hand and nail care on one hand, and you notice the person has 2 hands, you're going to just do it on one hand. Make sense? Okay. While we're performing these skills, we should be making observations. And this actually is the most important job we have. So I want to explain something about this really quickly. I call this alphabet soup. Okay. If you're working in assisted living, we don't call you a CNA. We call you a resident aide. If you're working in rehab, we usually don't call you a CNA. We'll probably call you a nurse tech. If you're working in a hospital, we're probably calling you a patient care technician. If you're working in mental health, we're probably calling you a mental health technician or a behavioral tech or something like that. We have a lot of different initials out there, a ton of different initials out there. What is the difference between a CNA and all those other things? This. CNAs are state tested. That means that you've gone through the state exam, you've had your skills independently verified by a third party, and that's what makes you certified. That's the C part of CNA. Okay, just means a third party, a state testing agency has evaluated you. Good. Now, if you're working in an assisted living facility and you never went through that testing process, we can't call you a CNA. You're only certified once you've tested. So we have to call you something else. So used to be years and years and years ago, there was nurse aides and there were CNAs. Nurse aides did the same thing. They just weren't tested. You got the C part once you went through the test. Good. Now that got a little overused. Okay. Some facilities would try to stretch those boundaries a little bit. So now instead of just having NA and CNA, they created all these other acronyms. PCT, PCA, all these other things. It's important for you to understand that none of those are state regulated. Those are only used by employers. And employers get to pick which ones they use. There's no regulation agency that says you can only work in a hospital if you're a PCT. No, if a rehab wants to call you a PCT, they can. If mental health wants to call you a PCT, they can. This is employer-based, not legal-based. You guys understand the difference there? Okay, so what makes the difference between a CNA and all those other things are, number one, the state exam, and number two, observation and reporting. So all of those other things, and you'll hear it all the time. Well, I'm a PCT. I do the same thing as a CNA. And they're right. They do. Physically, they do bed baths. They feed patients. They help patients get dressed. They help with ambulation. They do the skills part. But they have not been trained on observation and reporting. This is where we have to know abnormal from normal. Okay. If we understand the normal signs of aging, then we're much more likely to identify something abnormal. Now, there's only 2 places in Florida that you have to be a CNA to work. One of those is a nursing home, and I'll explain why in a minute. The other one is home health if you don't have anything else, like a home health aide behind you. Okay. So home health aides have this understanding, the same understanding of observation and reporting at a little bit lower level, not quite as intensive. And their patients are much more stable. Okay. Good morning. That's okay. Does that make sense? Everybody with me? Okay. So PCT, PCA, NT, NA, all of those other acronyms, they, sorry, I just got derailed there for a second. Hold on. All those other acronyms are going to do the same tasks, but their observation reporting isn't going to be as strong. Now, the reason is that they're working in positions where nurses are right there. Hospitals, nurses, right there. Mental health, nurses, right there. Rehabs, nurses, right there. So we're working as part of a team. We're a part of a team, but the nurses are the ones that are going to make the observations and report. That's why you don't need to be a CNA to work in a hospital, because nurses right there. Make sense? So they can hire you and they can call you something different. Now, they may, if you're certified, if you are a CNA, they may keep that term for you, or they just may apply the same term as everybody else. Good? Makes sense? But there's only 2 places in Florida that you have to be a CNA to work. And that's nursing homes and home care if you don't have something else, home health aide or something else. It's important that we understand this. The reason you have to be a CNA in a nursing home is because nurses are not right there. In a nursing home, we do have nurses. Yes, absolutely. But it's one nurse for the entire wing. So we don't have the same staffing ratios that we have in hospitals or rehabs or places where patients are changing much more rapidly. So in a nursing home, our staff is spread much thinner on the nursing side, and we have more CNAs. Well, if we have more people that are having eyes on the patient, we need to make sure those people are going to identify changes quickly and report them to the nurse, because the nurse doesn't have as much interaction with those patients. Do you see why this becomes a very important part of CNA? Remember, there's only 2 places you have to be a CNA to work, and that's nursing homes and home care if you don't have something else. And the whole reason is you become the eyes of the nurse. We have to know what to report, and we have to report that quickly for prompt intervention, prompt assessment. And this is why in a nursing home, you must be certified, because you truly are the first line of defense. So that means that as a CNA, you can apply for those hospital positions. But remember that you don't legally have to be a CNA to get them. Now we kind of have to talk a little bit about the difference between legal and employer. As an employer, I can set the standard for whatever I want my employees to have. If I want every single one of my employees to have a master's in art history, I can set that standard. There's nothing legally that says that I can't. I can ask that every single person I employ is a welder on the side. I get to set the standard of what I am looking for as an employer. Does that make sense? Okay. So as an employer, I want people that are already trained and that have already been assessed by an independent third party, that their skills have been verified. Good morning. Their skills have been verified. So therefore, on my job descriptions, I'm going to put CNA, because I know those people have been trained. They have good observation skills. And even though legally you don't have to have your CNA to work in that setting, from the employer standpoint, they're going to say, we want to employ CNAs. They don't have to pay accordingly. There's no, I mean, they have to pay minimum wage. That's it. That's it. That's the only standard. They have to pay minimum wage. There is no state statute that says once you get your CNA, you're going to get more money. There's nothing like that. Employers are probably going to pay you more because they want to keep you. They want to attract people that are certified. Does that make sense? Okay. So this is truly the law of supply and demand at work. So if I only have 20 CNAs in the county, okay, I've got 300 people that can work as, caregivers that can feed people or dress people or whatever, right? Because that you can figure that part out pretty much on your own, right? I could just hire you, tell you go feed that person, and you could probably figure it out. So I got 300 people that could figure it out, and I've got 20 who are certified. Now, I'm competing with all the other facilities that want those 20 people. So that means that I can't pay those 20 people the same amount that I pay the 300 people that aren't certified, right? So in order to attract and retain staff, pay is going to go up a little bit. But there's no state law that says once you reach CNA, you get a pay bump. That's according to the facility. And what this means is when you go out and you start working, the people that are interviewing you are going to offer all different kinds of money. There is no law that says CNAs all start at $22 an hour. There's no law that says that. So when you go apply for a job and you interview, and let's say we interview with company A, and company A offers you $19 an hour, full-time with benefits. Company B offers you $22 an hour, PRN, which is as needed, no benefits. Company C offers you $20 an hour, part-time, with an opportunity to advance. We pay for tuition reimbursement if you decide to go on for additional training. So you would want to look at those three opportunities and evaluate which one is right for you. If you need benefits, A would probably be the right choice. If you're looking to advance, C might be the right choice. If you want flexibility, like you don't want to work holidays, you've got big holiday plans. If you are full-time, you're working holidays, people. It's healthcare. Sick people don't take a day off of being sick just because we have a holiday. So if you're working full-time, you're rotating holidays. There is no way around that, period. And you're probably going to have to submit for time off. So if I got a cruise coming up in June, I got to tell my employer, hey, I got a cruise coming up in June. I'd like to take this week off. And I got to hope that they're going to let me take that week off. They may not. So if flexibility is important to you, then you would want to choose the option that is more flexible. Make sense? Okay. So it's important that you understand the role that you play as a CNA, the important part of that role, which is observation and reporting. That's what sets you apart from other people, but also what a CNA is in relationship to all these other acronyms, PCA, PCT, mental health tech, behavioral tech, nurse tech, all of those other terms. Good? Make sense? Okay, little lesson in legalities today. All right, every skill that we do is going to start the same way. Every skill starts with the opening. Every opening starts with a knock. Then we greet our patient. We address them by name. And then we introduce ourselves by name and title. Then we want to tell them what we're there to do. I am here to whatever. And we're going to ask the most important question in healthcare. Is that okay? This is important, guys. We have to get our patients' approval. We have to get their cooperation. Help isn't help if it doesn't help. Now, I do want to take just a moment to talk about dementia here, though, okay? Because a lot of people see this, right? I have to get permission. And they immediately think, yeah, but dementia patients can't give you permission. And in a certain component, that's technically correct, okay? They like their music so much, they share. Okay, so that's technically correct. Dementia patients, they lack the reasoning ability to be able to have bodily autonomy. And I understand that. However, that doesn't negate our responsibility of involving the patient in their care. So let me explain to you a little bit about what it's like to have dementia. So you can kind of understand a day in the life of. Okay, all of you guys speak English, right? Does anybody in here speak Russian? Anybody speak Russian? No? So, okay. So if tomorrow morning you woke up, your eyes popped open, and you looked around and it wasn't your bedroom, you have no idea where you're at. Nothing looks familiar at all. Nothing. You look around and you're looking for your family members. You're looking for somebody familiar. What happened overnight? Why am I here? What's going on? And you don't recognize anybody. So you start asking questions. Where am I? Can I go home? Why am I here? You want to know this, right? You're not in a place you think you're supposed to be, and you're not surrounded by people you know. You got questions. So you start asking questions, and the answers that you get back are in a language you've never heard, like Russian. Like they're talking to you, but you have no idea what's being said. No clue. What is your fear level going to be like? How scared are you going to be? You are in a strange place, surrounded by total strangers to you, nobody you recognize, and they're all talking a language you don't understand. You don't know why you're there. You don't know why you're not home. You don't understand why they won't let you leave. What do you think your mood is going to be like? Yeah, you're going to be angry. You're going to be frightened. And you're probably going to be trying to find an exit pretty quickly. Does that make sense? Everybody with me? That is what it is like to have dementia. When you look around, you aren't recognizing anything, nothing. It's all foreign. The people that you see, you don't know. And when they talk to you, you can't understand what they're trying to say. Now, you're scared, you're alone. This is extremely frightening. And now they come at you and try to put their hands on you. Do you have any idea what they have planned for you? No. And even if they're talking, even if their mouths are moving and you hear sounds, it doesn't make any sense to you. So they may be saying, calm down, everything's fine, I'm just going to give you a bath, but you have no idea what that means. This is why dementia patients fight staff members, because nothing looks familiar. They don't know the people, and people come at them and put their hands on them without any awareness of why that stranger is touching you. Do you see why they might fight back? Okay. So yes, getting consent, getting their participation is actually pretty important here. Now, we may not be able to do this in a traditional way. We may not be able to say, hey, Miss Jones, I need to give you a bath today. Because if she isn't understanding my words, that doesn't help. So I now need to rely on things like my body language, my facial expression. I want to slow everything down. I don't want to be rushing at her. I need to slow everything down. We need to develop some sort of a relationship here. If you've never seen me before and I start taking off your clothes, you're probably going to have a problem with that. Right? So we need to develop a relationship here. I may need to pantomime what we're about to do because gestures are a little more universal than speech. So I need to adjust my communication attempts to the level my patient can understand. And then I need to get them on board. Because if I start taking their clothes off and they don't understand why and they haven't consented to participate, this is going to be a fight. So yes, even with dementia patients, we still need to get their participation. Now, if my dementia patient does still understand some of what I'm saying, I'm not going to ask, do you want a bath today? Because when you lose bodily autonomy, you will cling to whatever gives you power. Let me explain this. Have you guys ever seen a 2-year-old? 2 and 3-year-olds, those are my favorite age group ever. I love 2 and 3-year-olds because I understand them. You'll hear people say, oh, the terrible twos, and 2-year-olds throw temper tantrums, terrible twos. This is why they do that. There's a reason behind it. They're not just being bratty. When you have somebody who has no power, right? 2-year-olds have no power. They have to rely on you to bring them food. They have to rely on you for shelter and clothing. They have to rely on you for everything. They have no power at all. And then they learn the power of the word no. The word no has power behind it because you have been saying that to them for 2 years. No, no, don't touch that. No, don't eat that. No, don't put that in your mouth. You have been training them that that word no has power. And somewhere around age 2, they learn how to use that power. And now they've got the power, they're not giving it up. So if you ask a 2-year-old, do you want to? They're going to pull that word out and say no, because they have power with that word. Does that make sense? It's the only thing they have power over. That's it. So a 2-year-old will tell you no for everything unless you're offering them a cookie or ice cream. They're okay with that. But everything else, they're going to tell you no. So if you really want to work with a 2-year-old, you never ask yes, no questions because the answer will always be no. You give them limited choices. Do you want to put your shoes on now or after breakfast? We didn't give them a yes, no. Now they're choosing between one of those two options. And this is how we get 2 and 3-year-olds to kind of move to our will while still giving them power. Make sense? Make sense? So if you have 2 or 3-year-olds in your life, start using this. You'll actually find that they become much more compliant. But it also helps with their overall autonomy because they need to use power. This is how they begin to separate from others, form their own individual identity. They need some power. And then every so often, throw a yes, no question in there and then honor their no. Don't throw a yes, no question at a child if you're not going to honor the no. If you say, do you want your bath now? And they say no, you're going to pick them up, throw them in the bathtub anyway. That tells them that that word no only has power when you use it, not when they use it. That's authoritarian. People rebel against authoritarian. Now you've set up a system where your 2-year-old is going to rebel against you every chance they get. So you give them yes, no questions, but you honor the no. Everything else is limited choice. Does that make sense? Little psychology there. We use that same psychology with dementia patients. Same psychology. We don't give them yes, no. Do you want to go to lunch? They're going to say no because it's the only word they have that has power. And right now they're feeling pretty powerless. So they're going to say no. What you would want to say is, do you want to put your shoes on now or before we go to lunch? Give them a limited choice. And then every so often, give them a yes, no question that you know they're going to say no to and honor the no. That allows them to reclaim that power and they will be much, much less combative. They're combative because they feel like they have no power. Make sense? So this Way, way, way more important than you think it is. Way more important, because people without power will rebel. Period. That is human nature. People without power will rebel. And when we put a person in a facility, we have stripped them of their power. Because if they had power, where would they be? At home. Absolutely. Does this make sense? Okay. Once we get all that out of the way, we're going to close that privacy curtain. Who touches these curtains? Everybody. They are full of pathogens. So what do you want to do after you close that curtain? Wash your hands. Absolutely. And then once we have clean hands, we'll go get our clean supplies. One of the supplies that we may need, our cardinal rule here, don't touch the patient until your hands are clean. One of the supplies we may need are gloves. It's a possibility. If we are going to touch body fluids, personal skin, or non-intact skin, we need a set of gloves to do that. If we're just touching plain old regular intact skin, you don't need gloves for that. You wash your hands before and you wash your hands after, and that's all the protection you need, because pathogens don't drill. Good? But if you are going to touch a body opening, a doorway that lets stuff into the patient or lets stuff out of the patient, then yes, you need an extra layer. And that's really not to protect you the way you think it does, because pathogens get through those gloves over time. What it does is it keeps you from bringing those pathogens that are on your hands to an area that has doorways. You wouldn't put your gloved hand up here and rub your nose. You'd see the glove and remember, oh, ickies, cooties. I'm not going to put that on my face. Make sense? All right. If we do need gloves, we have a rule. The first thing those gloves should touch is the patient. Keep your gloves clean for the patient. Now, I see this all the time. People will walk in a room, they'll put on a pair of gloves, and then they'll do a ton of stuff with those gloves, and then they touch the patient with those gloves. And all those pathogens you just came into contact with, you have transferred to the most vulnerable person in this scenario. The most vulnerable. You might as well have poured them a cup of toxic sludge and handed it to them, because that's what you've done here. So if you're going to wear gloves, keep those gloves clean for the patient. They're the ones really that we need to be concerned about. Their body is fighting something. Otherwise, they wouldn't be here. Immune system is busy. Now, once you've touched the patient, you've got contaminated gloves, right? Your gloves are all icked up. So be careful about what you're touching in the environment. Try not to overly contaminate the environment, especially because remember, we're only wearing gloves if we're touching body fluids, personal skin, or non-intact skin. So we've got some pretty industrial grade cooties going on here. We don't want those spread in our environment. And then if you do wear gloves, make sure you remove them correctly. So we pinch up at the cuff, pull it off, and then go under and pull that one off. Questions on gloves? If you need supplies, you need a place to put them. So we're going to use a barrier. Anything can be a barrier, but for the exam, we're going to use a very specific kind of barrier. Remember that this table is not clean, but our supplies are. So if the table is not clean and the supplies are, we got to have something to separate the two. So we get a barrier. We put that on the table, and then we get our supplies and put the supplies on the barrier. Do not hold the supplies up against your uniform. Your uniform is not clean once you start work. It leans up against the sink. It brushes against the curtain. It kneels on the floor. Uniform is not clean. So don't hold stuff against your uniform. Go get the barrier, put it on the table, go get your supplies, and put those on the barrier. Another supply that we may need, and please remember that everything we're talking about right now will not be on the care plan. Care plan isn't going to tell you to wear gloves. Care plan isn't going to tell you to use a barrier. Care plan isn't going to tell you when you need a privacy blanket. Care plans don't tell us these things. These are why we're in class. This is what we need to know to do the skills. Anybody watch the game show yesterday? Game show? All right, the game show yesterday were 15 questions, all on skills, all on these principles. When to wear gloves, where to keep the patient, how to check the water. All of those things were questions on the state exam, but they're not going to tell you or ask you, when do you use a privacy blanket? It's going to give you a scenario. You're dressing a resident with a weak arm. What supply do you need to promote privacy? Okay. So if you didn't get a chance to watch that game show, go back and watch the replay, because these questions will show up on the state exam. You need to see how they're going to be structured. The first couple, I was really easy. Those were no-brainers. Toward the middle and the end, they got much harder, because that's how the state exam is going to present the information. Okay. So privacy blanket. We use them not just for privacy, but also for warmth. We're going to use them anytime the patient is uncovered or undressed. And remember, our care plan is not going to tell us about this. We're going to put it on top of the sheet. Don't snap it or shake it. Put it on top of the sheet and pull the sheet down underneath so your patient is always covered. Snapping and shaking aerosolizes all the pathogens. Everything that's on that bed, woo, right up here in midair that you can breathe in. That's dead skin cells, yeast, bacteria, somebody else's funk. You don't want to breathe that in. And then at the end of the skill, if you're wearing gloves, remove those gloves before you remove the blanket. You don't want to touch that sheet that's going to go right up next to the patient's face with body fluid gloves. That's gross. Good. We also learned about linen rules. Now, most of these are repeats of things that we've already learned. Linens cannot touch your uniform. That is an infection control consideration. You have to have clean hands to get your linens. Again, infection control. Don't snap or shake your linens. Again, infection control. And then we learned something new on Monday. Clean, oh, it's not on there. Clean rolls toward me, dirty rolls away. We also learned that nothing goes on the floor except shoes. Good. All right. I actually had a student reach out to me about 3 or 4 weeks ago, and she says, I got to tell you this. I was laughing during the exam. The person that she was partnered with was throwing the used linens, and I don't know whether they're washcloths and towels or sheets from the bed, I'm not real sure, but threw the used linens on the floor, and all she could hear in her head is nothing goes on the floor but shoes. And she wanted to shout it out at this person, and you can't, because they're being tested. So you kind of have to bite your tongue and don't say anything and don't react. She says, but I had to come back and tell you. That's what went through my head. Nothing goes on the floor but shoes. Nothing. So this is an important testing principle. Haja says, your videos helped me pass both my skills and written exams. Thank you so much. Congratulations. Great job. Thank you so much for coming back and telling us. We appreciate it. All right. And then anything we don't use, we take but don't use, has to go into dirty linen. And we've already talked about those. Okay. Patients have to be in the middle of the bed, and we cannot rely on side rails to keep them there. Patients have to be in the middle of the bed. That's the safest place for a patient. Not on the edge of the bed. Even with the side rail, that patient is going to feel like they're in danger. If you put a side rail up and roll a patient so they're right up against that side rail, it's going to be uncomfortable because now they're pressed up against metal. But psychologically, their brain is going, we're not safe. And they're going to be constantly on edge. Patients must be in the middle of the bed. Side rails are not used to keep them safe. In order to do that, we're going to scoot them toward us and then roll them away from us Always roll a patient away from you. Okay. Don't turn them towards you. You never want to turn a patient so they're eye level with your crotch. It has to be said, guys. When you roll a patient towards you, that's what you've done. You've put them eye level with your crotch. And even if you're female, it doesn't matter. It's still a threat. It is still a threat. But it's also very poor body mechanics because all of our body weight is along our back, shoulders, back, butt, hips. All of the body weight is back here. Gravity pulls you back onto your back. You put 20 people on their side, 20 of them will roll back onto their back if you don't support them. It's gravity. So if you've turned somebody toward you and gravity is trying to pull them away from you, that means you're going to have to stretch to keep them from rolling. That's bad for your back. It's bad body mechanics. But even more importantly, you're in that stretch likely to fall on the patient when you lose your balance. Do you guys understand this? We do not roll patients toward us. And there are a lot of YouTube videos out there, that show caregivers rolling patients toward them. Do not do that. Okay? Patients must be in the middle of the bed, always. So when you're doing skills where you're moving that patient in bed, you should always have this in the back of your mind. You should be looking at that patient. Are they in the middle of the bed? The steps don't matter. You can't say, well, yeah, I scooted them toward me. Who cares if they end up in the wrong place? That makes no difference. No difference at all. That's like saying, yeah, I put my seatbelt on when you intentionally run over a pedestrian. Okay, you can't just do the step and hope it's okay. Look at the patient. That's what matters here.
No, I was asking because when you were showing us the other day about, changing the sheets with the patient on the bed, so we have to roll the patient towards, not towards, against us, right?
You scoot them toward you.
Uh-huh. Okay, but toward.
You scoot them towards you.
Okay.
Scoot them towards you. Okay. And then you roll them on their side away from you.
Okay. And then I move to the other side, right?
It depends on what you're doing, but you should never be on the same side the patient is facing. So if we're changing the sheets,
Yeah.
that's a live patient skill. Your patient will be able to lay on there. If I let go of her, she's going to fall back.
Changing I don't know, anything. And I need to move him to the other side. I have to go to the other side and move him.
Right.
Okay.
So you would roll them up on this side, take care under here what you need to do, back on their back, scoot to the middle, go to the other side of the bed,
And then
scoot them towards you, roll them away, and then change them again. Okay, good?
yes.
Remain behind the patient's behind. That's how we remember that. You should never be on the same side of the bed as the patient's face. Okay, good. All right. We learned washing rules as well. Basins are no soap zones. We don't add soap to the basin because we need water for rinsing. Okay, no soap in the basin. We add soap to the wet washcloths instead. We use a paper towel to turn the faucet on because that faucet is not clean. So paper towel to turn the faucet on. Remember, we've read our care plan. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to wash something. Is that okay? Close curtain, wash hands. Got supplies. Now I'm ready to get my water. So I've got clean hands. I've already washed them. I cannot touch this faucet with clean hands. So I'm going to get a paper towel between the faucet and my hand to fill the basin. Now I'm going to check that water temperature with the inside of my wrist. It should feel warm, not hot, not cold, just warm. Who else needs to check that water temperature? The patient, every time. If the patient says, no, it's too cold, warm it up. If they say, no, it's too hot, cool it down. Don't argue with them. Oh, it's fine, I checked it. Good for you. Glad you checked it. It's not comfortable for me. You don't have any say in this. Don't argue with the patient. Good? Okay. We're going to cover that step later. Whatever we wash, we rinse. Whatever we rinse, we dry. You've got to say this in your brain because you will forget a step. You will. You will. So as you're washing something, your brain, you don't have to say it out loud, but inside, whatever I wash, I rinse. So now you know your next step. As you're rinsing, your brain should be saying, whatever I rinse, I dry. And now you know your next step. I say it out loud. And I say it out loud because the patient doesn't know what I'm going to do with them. I am working on somebody else's body. I need to keep that in the front of my mind. These are not my skills. These are not my skills. These are things I'm helping the patient with. And if I'm not involving them, I'm not helping them. I'm doing it to them. I have reduced them to a lump of flesh. I've removed their autonomy. And that is a horrible thing for any human to do to another human. Good? Okay. We're going to change that water if it gets cold or soapy. And we're going to make sure that we keep our surfaces dry. So on the table, we have a barrier for that. If I'm working in the bed, I need to cover the sheets with a towel or a chucks or something. If I'm working on the floor, I need to cover the floor with a chucks or something waterproof so that any liquid doesn't spill onto the surface. And then if we apply lotion, we warm it up in our hands first, we apply it, and then we wipe off the excess. If we used a basin for any reason, we then have to clean it. So basin cleaning looks complex, but it's really not. We're going to dump the liquid, the fluid, where it normally goes. Just put it where it normally goes. Toilet, sink. If it's bathing, sink. If it's saliva, sink. If it's body fluids, toilet, right? Where it normally goes. And then you're going to rinse the basin and you're going to dump the rinse water where you put the fluid. So if you put the fluid in the sink, rinse water goes in the sink. If you put the fluid in the toilet, the rinse water goes in the toilet. And then you're going to set it down in the sink. If you have to disinfect for any reason in a clinical setting, that's when you would do that step. We're not doing that for the test, but we're going to set it down to show we know when. Then we're going to use a paper towel to pick it up, a paper towel to dry the inside, a paper towel to dry the outside, and then we're going to grab one more paper towel to gather our supplies and open the drawer. Then we can throw those paper towels away and remove our gloves if we're done with the skill. Good? All right. And then we learned the closing. Now, the closing is how we end every skill. Do it the same way every time. That way it kind of sticks in your mind. So we're going to look around and make sure they're in a clean and safe environment. So look around. Is it clean? Are the sheets arranged nicely? Is there trash on the floor? Is it clean? Make sure the bed is in the low position. This is safe. You also need to look and see if they're in the middle of the bed. That was part of scoot and roll, but that's part of safety as well. We're going to ask about comfort. They need to hear this word. Are you comfortable? And then we're going to address emotional comfort by addressing preferences. Would you like a magazine? Would you like your remote? Would you like a crossword puzzle book? Something, okay? We know it's boring to lay there with nothing to look at. We get it. So give them something. You're going to make sure they're covered at all times. This should be taken care of with a privacy blanket, right? If we used a privacy blanket while we were getting them dressed, once they're dressed, we don't need a sheet. If we used a privacy blanket while we change their linens, once their linens are on, we don't need, they're covered, right? So this is usually already covered, but take a minute, take a look. Do you see knobby knees? If you see knobby knees, you know that you took a wrong turn somewhere. Your patient is exposed. Probably should correct that. I would say correction. I would not have my patient uncovered. Okay, privacy counts. You're going to open the curtain and give them the call light. The order of all those things don't matter. They just don't matter. You can do them in any order you want. You can say, thank you. I like to thank my patients. They're the reason I have a paycheck. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Your environment's clean. Your bed is in the low position. Here's your call light. Open the curtain. It does not matter how you do these steps, what order. It matters that they're all done. Once you get all of that done, we want to get rid of those cooties. Go to the sink, wash your hands. After you've washed your hands, then you can document if it's a documentation skill. And then after you document, you wash your hands again. Questions? Questions? Okay. We also learned some skills. We learned how to wash our hands. We wet our hands. Always wet your hands before you put soap on. You get some soap on your hands, get a lot. You're graded on bubbles. And you start to rub. When you start to rub, you look at the clock and see where that second hand is because you have to rub for at least 20 seconds. So you rub all surfaces, the tops of the wrists, in between the fingers, in the back of the hands, in between your thumb and index finger, the bottom of your hand by your pinky, the palm of your hand interlacing your fingers, all of those areas for at least 20 seconds. Then you go down each one of your nails with your thumb. You circle the nails on the palm of your hand, and then you rinse. After you rinse, oops, let me go back. After you rinse, you tap to keep the water confined to the sink so it doesn't go everywhere. Tap. Get some paper towels, whatever you need. If you need 2, use 2. If you need 8, use 8. Nobody's counting. I just usually get 3. I dry what's clean. I don't go up here. Is up here clean? So I dry what's clean. And then I throw those paper towels away. I get a clean, dry paper towel to turn the faucet off. A lot of facilities, new facilities, particularly new construction, have foot pedals to work the water. And that's a good feature because now we're not touching that faucet. We don't have that in the testing centers, though. Use a paper towel. All right, we learned how to take a pulse. Pulse is a measurement of how many times the heart beats over 1 minute. So we use the radial pulse at the wrist, which is located at the very top of the thumb side of the wrist at the bendy lines. We use 2 fingers, fingertips, not flat part, never thumb. 2 fingers at the bendy part, right where the thumb comes off of the hand, and then put your thumb on the back side. You're going to pick a starting point on the clock, and you're going to say start out loud. When you say start out loud, you're going to count what you feel under your fingers until you get to that starting point again, and you say stop out loud. This was one of the questions I had yesterday in the game show. How long do you count a pulse? And the answers were A, 1 full minute, B, 15 seconds and multiply by 4, C, until you get 60, or D, as long as the care plan tells you. What do you think the right answer is? As long as the care plan tells you. It could be 1 full minute. A might be right. It could be 15 seconds and multiply by 4. That might be right. It is never C. But I thought that was a throwaway answer. I thought nobody in the world was gonna pick that answer. And I had 6 or 7 people on the game show that thought you counted the pulse until you reached 60. Normal is between 60 and 100. Is everybody going to be normal? No. So it's not how long does it take us to get to 60. That has nothing to do with this. It's we count for 1 full minute or as long as care plan tells us to. And that is our pulse number. It could be between 60 and 100, but it could also be 48. It could also be 112. What will we do with those 2 numbers? Tell the nurse. Right. I kind of thought that was a easy answer. That surprised me. We don't count to 60. In Florida, we are going to count with 2 evaluators. This is a documentation skill. We learned how to dress a resident with a weak arm. And you want to ask them about their clothing preferences. What do you want to wear today, Miss Jones? You're going to get the clothing first before you undress them. Protect their privacy. So we're going to use a privacy curtain. We're going to use a privacy blanket. And we undress the strong arm first. We do that by lifting from below and supporting our joints. Don't overextend or force movement. So we're going to remove the garment from the strong arm first, and then we're going to dress the weak arm first. We adjust the clothing for neatness and appearance. Make sure they look right, and give the call light into the stronger hand. We've learned range of motion. We actually have learned 2 range of motions so far. We lift extremities from below with a flat palm. We have 2 points of support near the joints. We move slowly and smoothly all the way back to start. Flexion extension is up, down. Abduction, adduction is side to side. Rotation is around. You are not going to do all the exercises on all the patients. How do we know what exercises to do on this patient? The care plan. How do we know how many repetitions to use? The care plan. Follow your care plan. We learned how to do hand and nail care. This is a mini mani. That's all it is. We soak the hand, we take it out of the water, we put it on a towel because towels are soft, and we wash the hand. When you're washing, we don't put soap in the basin. We wring those washcloths out. No drippy wet washcloths, guys. Wring the washcloths out really well, put soap on the washcloth, and wash the hand over here on the towel. Then we take that hand and put it back in the basin to rinse. Use a second washcloth to kind of squeeze the water on to rinse it really well. And then we put it back on the towel to dry. We'll use the slanted end of the orange stick to clean underneath each nail, wiping it off on the towel in between patients. And then once we have the nails clean, we're going to file the rough edges one direction only toward the center, not back and forth rapidly. And then we're going to warm up our lotion, apply it, and wipe off the excess. It's a mini mani. Good? We learn how to make an occupied bed. This is my favorite skill. I love this skill. Clean rolls toward me, dirty rolls away. This is how we change anything that's under the patient, whether it's a chucks, a sheet, anything. Whatever's under the patient, draw sheet, whatever's under the patient, this is the method we use. Patient must always be in the middle of the bed, but we want them to take up the least amount of space possible. So we scoot them toward us, turn them on their side so they're in the middle of the bed, but on their side. Okay? We roll the dirty sheet toward the patient, tuck it under them, roll the clean sheet toward us, tuck it under them, and then we have them back on their back. We go around to the other side of the bed, repeat the process. Put the top sheet on, secure the bottom and the bottom corners using hospital corners. Questions so far? Loosen the sheet on the toes and then change the pillowcase. I love that skill. That's an easy skill. Look how much you've learned. We are at the halfway point, and we have several skills to get through today. We're going to learn 4, in fact. And we're also going to register for this or do the test registration process. You're going to register when you're ready to. You don't pay me money. You pay it to the testing agency, not me. We're going to go through the process today. Okay. So we have a lot to go. All right. So when we're looking at these principles, remember, principles are things you have to know. They're not on the care plan. We have covered all of these except for this one. This is the last one left. You guys remember me saying on the first day, by the halfway point, you would know everything on that wall? By the end of week 2, you know everything. And you all looked at that and you thought, oh my gosh, that's a lot to learn. I mean, your eyes got real wide and you wondered, how am I going to do that? Was it hard? Was it hard to learn these things? Yeah. Okay. So we have one more to go. And then from now on, all we have to do is combine this one and this one and this one and this one. And we're just going to use them as building blocks to create skills. So everything that you've learned up until this point, we're just going to use over and over and over and over again. And that's how this program becomes easy. First 2 weeks are the hardest. It gets easier from here. So congratulations to you. You got through the hardest part. Okay. Remember that we do have the testing care plan sets. We also have the pocket cards available to you as well. This is all on page 25 of your book. All right, so we're going to learn supported side lying. This is on page 138 of our book. If you look down here, you can see all of the principles involved in this skill, and they're all spelled out for us here. This is our short version up here. And then down here at the very bottom is our test-specific information. Somebody with your level of experience, which is none, should be able to do this skill in 8 minutes or less. This skill, you're going to turn somebody on their side and prop them there with pillows. Doesn't take 8 minutes. Take your time. I'm going to show you how to do this, but it doesn't take 8 minutes. This is a live testing student. So you may be the patient in the bed for this, and this is the most comfortable position you'll ever be in your entire life. This is amazing. If you can get somebody to tuck you into bed like this at night, you'll sleep like a baby. It is the most relaxed you'll be. This person's going to be positioned in the bed. Documentation is not required. So on page 139, we find our care plan, we find our step-by-step instructions, and we find our supplies. Remember, you have to learn your supplies. It's not going to be on the care plan. Here's our care plan. Position the resident on his left side. Can you roll him on his right? Yeah. Why? That's not what the care plan says. That's right. We're going to follow that care plan. Very good. Very good. Patient requires support to remain on his side and is unable to assist with turning. That's our key here. With make an occupied bed, they were able to move as directed. We just asked them, can you roll on your, can you scoot toward me? Can you roll on your side? We asked them what to do. They did it. This guy can't do that. So we're going to have to change our approach a little bit. Okay. And that's really what this skill is all about, is learning how to position a patient to make that roll super easy on them and us. Okay. But I want to bring your attention to something. Every word on the care plan is intentional. And remember we talked at the very beginning today that we follow the care plan, the whole care plan, and nothing but the care plan. This care plan is trying to trip you up on this. Okay. This right here, unable to assist with turning. Does that say this patient cannot move? No. Ah, your brain tried to make it that though. Your brain tried to change this care plan without your permission. It does not say this person is immobile. It does not say this person is paralyzed. It does not say this person cannot move. What does it say? They're unable to assist with turning. Turning is different than immobile. But your brain changed that care plan. Do you see how easy that is to fall into that trap? This is why I spent so much time earlier talking about don't change the care plan, because your brain will do it. Your brain will do it. Why am I making a big deal out of this? Because the patient can't assist with turning, but we can't ask them, can you scoot toward me? Those are two separate things. So how in the world, how would that work? I mean, what kind of patient would be able to scoot but not roll? How does that work? Well, imagine somebody that just had open abdominal surgery and we cut their whole belly open and then we stitched it back together. This person isn't going to be able to fly. Their sides of their muscles aren't even talking at this point. They are divorced. Okay. They're not going to be able to work together to move the patient, but they can scoot laterally. Make sense? Okay. So just because, and this is so important for you to understand, guys, just because your brain cannot come up with a scenario that fits this care plan doesn't mean one doesn't exist. So we just go by the care plan. We take it at face value. We don't add to it and we don't take from it. Good? Make sense? We know all of these principles. There is nothing principle-wise to learn for this skill. We know to follow the care plan. We know to do our opening. We know to evaluate if we need gloves. We know to use a barrier for our supplies. We know that if we're going to uncover the patient, we're going to use a privacy blanket. We know not to hold anything against our uniform. We know the patient must be in the middle of the bed, and we know how to end every skill. There's nothing new to learn here. So we're going to take all of these principles and we're going to combine them to make a skill. We are going to add in some skill-specific steps as well. So these are things that relate only to this skill. So let's talk a little bit about immobile patients, though. Even though this patient isn't immobile, I want to talk to you a little bit about immobility because you will be taking care of patients that are immobile. That term immobile means that they cannot move on their own. They can't do anything for themselves. They cannot move. So this patient can't toilet themselves. If they can't move, how are they going to get to the bathroom? This patient can't feed themselves. If they can't move, how are they going to eat? This patient can't do their own mouth care. If they can't move, how would they brush their teeth? This patient is going to need help with dressing. If they can't move, how do they get dressed? So immobile patients require total care. Do you guys understand that? Total care. It's important to understand a little bit about what immobility does to the body. Immobility is bad for us, very bad for us. It doesn't just affect the muscles. And this is what most people think about, right? We know about muscle atrophy. We know that muscles shrink when they're not used. We understand that. But immobility affects every body system. Remember, you just read about all those body systems in chapter 4? Immobility affects all of them. It decreases your immune function. It decreases your lung capacity. It affects your cognitive function. It affects your digestion. It even decreases bone density. That one's interesting for me. how in the world does laying around, not moving on your own, affect bone density? Well, we just had a space mission where they went around the moon. Did everybody see that? Right? We sent people to space, and they were only in space for what, less than 2 weeks, right? When they got home, they all had to go through physical reconditioning. This was 2 weeks, 2 weeks in a low gravity environment where their muscles did not have the effects of gravity and their muscles weakened. Their bone density was affected. Their eyesight was affected. It's crazy how much we rely on movement and the effects of gravity on our body to keep everything working properly. And when you have a situation where you're not moving and you're not upright and your muscles aren't engaged and we don't have that weight bearing, the body thinks, okay, well, these bones aren't really needed anymore. And it starts to break them down. Now, if we have a patient who is immobile and we accidentally drop them on the floor and they have decreased bone density, what could potentially happen to them? Yes, their bones will break. That is correct. Make sense? Okay, so immobility, bad for the body, very bad for the body. So we try whenever possible not to let a patient stay in bed all the time. We may use a mechanical lift to get the patient out of bed and put them in a chair. We may have physical therapy coming in, sitting the patient up, doing some exercises. That's not just for the muscles. It's for every single body system. Does that make sense? But the one that's affected the most is the skin. And we're going to see just how this works. And I'm going to show you just how quickly this can affect even healthy people. It's shocking how quickly this can happen. So for the next 2 minutes, and that's all I'm going to ask you to do is just 2 minutes, I want you to take one of your hands and put it underneath your leg and sit on your hand for 2 minutes. Now you're going to get uncomfortable. You're going to want to move that hand. I want you to put it there and try not to move. Keep it there. I'll let you know when to take it out. I'm only going to leave it there for minutes, okay, while I explain to you what immobility is. So when you're laying down, particularly on your back, every place a bone comes into contact with the surface that you're laying on is a pressure point. So the back of the head, the shoulders, the elbows, the back of the hips, the back of the thighs, the back of the calves, and your heels, these are all pressure points. This is going to be where bone presses down, and whatever's caught between the surface and the bone is going to be compressed. Make sense? Okay, so that's what this is. We saw this last class, this cross section. We have muscle, we have fat, and we have skin, and we have blood vessels. Well, when we have pressure pressing that bone down onto a surface, these layers get caught in between and they compress. Now, one of the things that it's compressing are these blood vessels, and it literally squeezes them shut like a straw. Now, if we've compressed those blood vessels to the point that they're closed, this area of skin is not going to get new blood. It's not going to get oxygenated blood. And that's going to cause that area of the skin, those cells, if they're not being fed, it causes them to become compromised, die. Everybody with me? Now, this can be further exacerbated if we don't have a smooth surface under this person. If we have wrinkles underneath the patient, those wrinkles, those areas, ridges, areas that are built up, are going to press up into the skin. So we have pressure pressing down and we have wrinkles pressing up. And the skin in between is likely to break down even faster. Make sense? Now, it's really shocking how quickly this can happen. When you have this situation, pressure from above and pressure from below, that skin in between breaks down, no blood flow, and it actually opens up and separates because those cells are dead. So they're not holding on to their friends. They're like this. So that skin that was intact actually separates. And we call this a pressure sore. So you guys are all healthy. Take your hand out. Look at your hand closely. Do you see color changes? Can you see the imprint of the chair or your fabric in your skin? Can you see that? That was 2 minutes and you're healthy. That is a pressure sore. This is pressure from above and pressure from below, trapping that skin in between and imprinting into your skin. Now, if we had left your hand there for hours and hours and hours without moving it, those lines would get deeper and deeper and deeper and deeper and eventually cut your skin open. It does not take long for this to happen. In the right circumstances, as little as 2 hours for a bed sore to occur.
I thought it was like, days.
As little as 2 hours in the right circumstances. Yep. For the most part, for most people, it's going to take a little bit longer, but certainly within a day. Certainly within a day. But remember that our patients are not healthy. If they were healthy, they'd be moving around on their own. These are not healthy people, which means their immune system is off doing other things. Their proteins are off building other tissues. These aren't healthy people. So where it may take you an entire day for a separation to occur, that's not who we're dealing with here. Does that make sense? So that's why I said in certain circumstances, this can happen very rapidly. So imagine what would happen if you kept your hand there for 24 hours without moving it. How uncomfortable. Now, you were probably getting pretty antsy after 2 minutes. You wanted to pull your hand out. You're like, this is a little uncomfortable. This feels unnatural. I'm ready to move. Thank you for playing along, by the way. But can you imagine that feeling over hours and hours and hours and hours and not being able to move yourself? That would become all-consuming after a little while. That would be the only thing you'd be able to think about. And when we have an immobile patient, that's exactly what happens. That's a bad situation for our patients. So when we are working with immobile patients, it's important that we find out, are you comfortable? If they're not, adjust. Get them comfortable. Because this is how they're stuck. Make sense? Good? All right. So when we have somebody that is immobile, unable to move themselves, we are going to turn them at least every 2 hours around the clock. At least. Your care plan may say more frequent, but the minimum is every 2 hours around the clock. Now, you do this yourself every day. Every day. Sitting in these chairs, you don't sit perfectly still. Not a single one of you sits perfectly still. You're swinging your legs, you're crossing one leg over the other, you're changing your position. You move constantly. And that's all because of this pressure. Your body is sitting on your butt. That area of your butt is getting a little numb. So you shift, you cross your legs, you move around, you slouch back. You're constantly moving to relieve these areas of pressure. And this does not change when you go to sleep. When you go to sleep, you are also constantly moving. You don't lay down and wake up in the exact same position. You toss, you turn, you stretch, you flinch, you move around. It'll come back. It'll come back. You're constantly moving. Make sense? Okay, so if we know that while we're awake, we're constantly moving, and even when we're asleep, we're constantly moving, that probably means that if our patient can't move, we need to move them constantly. So we are going to change their position every 2 hours around the clock. One of the biggest things that CNAs do that hurts patients, and they're very well-meaning about this, I don't want to wake up Mr. Jones. He hasn't slept the full night through for months. I'm going to let him get a good night's sleep tonight. I'm not going to wake him up to change his position. Now, that sounds perfectly reasonable, doesn't it? It sounds like we're doing a good deed. What you've done is created a huge bed sore on this patient, and they're not going to sleep for the next 8 months that it takes to heal. You did not do that patient any favors. You did yourself a favor. If the care plan says every 2 hours around the clock, what does that mean? Around the clock. You're waking them up at 2 a.m. You're waking them up at 4 a.m. Do not deviate from the care plan. You do not have enough information to make that decision, and you are gambling with somebody else's life. Good. Are you guys starting to see just how important this care plan thing is? Do you understand why the test is grading you on following the care plan? Because when you decide to not follow the care plan, you have made the decision to put this person's life in jeopardy without their consent. It's a lot of power for you to have. We've got to be careful and use it the right way. Good. If you remember, I said on the first day, CNAs kill just as many people as surgeons every year. We don't talk about it. I think we should be talking about it. The way that we endanger patients' lives is by not following the care plan, thinking we have a better plan. So when we are turning a patient, this is called a turning clock. If you do not have one of these and you're working with a patient, make one. This is well within the CNA scope of practice, making a turning clock, putting it up on the wall. As a nurse, when I walk into the patient at 2 p.m., or let's say 1 p.m., if I walk into a patient's room at 1 p.m. and I see the turning clock on the wall, right? Here's 1 p.m., I can quickly see what side should my patient be on. Their right side. My turning clock says at 1 p.m., this patient should be on their right side. I'm looking at the patient. Is this patient on their right side? No. So what does that tell me? Yeah, somebody's not doing their job. I better look at this patient's skin. Make sense? Okay. Turning clock. This keeps everybody on the same page. But while I'm in there and I see, oh, right side, the patient's supposed to be on the right side and they're not, I'm going to turn them on the right side. I'm also going to look at the skin just to make sure, but I'm going to use some pillows to keep them there because that's what's required. Does that make sense? Okay, so we're going to start out with the patient on their back. 2 hours later, right side. 2 hours later, back to their back. 2 hours later, left side. 2 hours later, back to their back. We have fewer blood vessels in our back and more robust muscles, and it helps prevent that compression. So when we have a patient on their back, we're going to relieve that pressure by going to the right side. And then 2 hours later, they can come back to their back. That's fine because those muscles have had a chance to reoxygenate. And then left side, and then back, and then right, and then back, and then left, and then back, and then right, and then back, and then left. Never on their stomach. Do not put an immobile patient on their stomach, ever, unless the care plan specifically tells you to. Because when you have a patient on their stomach, their muscles and their nerves have to be able to lift that patient off of that chest cavity for their lungs to inflate. And if we have somebody who doesn't have the muscle strength or the nerve innervation to lift off of their chest cavity for their lungs to inflate, we can suffocate them. This is why we tell new parents, don't lay baby on their tummies, because they may not be able, their muscles may not be able to expand that chest with gravity. Good. Same thing with adults. Now, there are some situations that as a nurse, I will put in the care plan to rotate the patient onto their stomach periodically as well. But you only do that when it's indicated in the care plan. Questions? So remember, scoot and roll. Patient must be in the middle of the bed at all times. That's what we're going to do here. If your patient is on their side and they're not in the middle of the bed, they're going to be too close to the edge of the bed and they're going to feel like they're at risk. So in order to make this happen, we're going to ask them to scoot toward us and then we roll them on their side. Now, normally your patient can do that roll themselves, and that's awesome if they can. But what if the patient can't do that roll themselves? We talked a little bit about this last class, the draw sheet. This is a flat sheet put underneath the patient. It's folded in half with a folded side up under their shoulders. It's folded in half. It goes underneath the patient, and we can use it as a sling to pull them toward us when we need to. Kind of moves the bulk of their weight toward us. For the test, for this skill, you can actually ask your patient, just scoot toward me. Okay, so it makes it easy. But you can use a draw sheet if your patient is immobile, if they can't scoot towards you. You can also move them in segments. We also have something called a slide sheet, which is super slippery. You put it under the patient. It's not wet, but you put it under the patient, and the patient just really slides really nicely. But you're going to get that patient moved toward you in some way for the test. We'll just ask them. And then we're going to roll them on their side. Now, normally they'll roll themselves, but this patient can't. It says they're unable to assist with turning. So in order to turn somebody on their side who can't do it themselves, we have to do a little prep work. And that's what this skill is all about, that prep work. So we have to know which side we're turning the patient to. And our care plan for this skill said to turn the patient onto their left side. So that means I'm going to turn, this is her left. I'm going to turn her to this direction. So I would need to be on the other side of the bed. Scoot the patient toward me. Now, I'm going to turn her, but I'm not just going to take her shoulder and her hip and try to manhandle her onto her side, right? That's going to hurt her. It's going to hurt me. It's not a situation that's going to benefit anybody. I'm going to prep her. The furthest arm goes above the head. So this arm goes above her head. If I were turning her on her right side, this arm would go above the head. Furthest arm goes above the head. Good. So step one, what side are we turning her on? That's what we need to know. Step two, position yourself on the other side of the bed. Step three, furthest arm from you goes above the head. Step four, closest arm to you crosses the chest. So you look like this. Step five, bend the closest knee and put the foot on the bed. And then step six, angle that furthest knee out. So your patient looks like this. Arm up, arm over, knee bent, leg angled. Now, when you get a patient in this position, you put a hand on the shoulder and one on the hip, and they just whoop right on their side. Super easy for them and you. All about proper positioning. Good? Good. So furthest arm up, closest arm over. We dropped again. Furthest arm up, closest arm over. Closest knee bent, furthest knee angled. Good. Once we get them on their side, make sure they're in the middle of the bed. If they're not, put them back on their backs, get them closer to you, and do it again. Don't ignore this. It's not enough that you did the step. It's where the patient is after the step that counts. Make sense? All right, so we're going to roll the patient gently away from us. And then we're going to put a pillow behind their back in a roll. So what I'm going to do is tuck one edge of the pillow underneath their back, roll the other edge up and under, and tuck it in a roll. This is what keeps this patient from rolling backwards. Remember I said gravity is always going to pull them back onto their back? So we need something to keep that from happening. Then we're going to come around to the other side of the bed and we're going to put a pillow between the legs, specifically between the knees and the ankles. We don't want those bones rubbing together. So that top leg, instead of the legs being one right on top of the other, the top leg, I'm going to move just a little bit off of the bottom. Just pull it forward a little bit and then put a pillow between. Then we're going to do the arm pillow. And this is the one everybody forgets. We're going to place a pillow underneath that top arm. And this, when you're laying on your side, this arm kind of falls. This puts a lot of pressure on the upper arm, the shoulder, and up into the neck. And it can cause headaches and muscle spasms. We want that arm in a neutral position. So we lift it up and put a pillow underneath, and it gets that arm in a neutral position, and we remove that stress. So we have one behind the back, one between the legs, one under the top arm, and then we look at the pillow already on the bed, the one under their head. Now, you want to make sure the arm isn't hanging off the bed. So we're going to adjust that pillow to make sure it's not under the shoulder, just under the head and neck. We're going to put the call light in that bottom hand and make sure it's not hanging off the bed. Good? That's the whole skill. So we do our opening. Good morning, Miss Jones. How are you? My name is Patty. I'm your CNA today, and I need to turn you on your left side. Is that okay? Close curtain, wash hands, get my supplies. Don't hold the supplies up against your uniform. I'm going to put a privacy blanket on and pull that sheet down so that we've got some working room for the legs. I'm going to go around to the other side of the bed. Arm up, arm over, leg bent, leg angled, turn them on their side, make sure they're in the middle of the bed. I'm going to put a pillow behind the back in a roll, one between the legs, pulling that top leg off, off center just a little bit. Put a pillow under the top arm, adjust the pillow under the head, so it's only under the head and neck. Put the arm not off the bed, under the pillow, call light in that bottom hand. And then I'm going to finish up. I'm going to pull the sheet back up and take the privacy blanket away. I'm going to do my closing. Thank you very much, Miss Jones. Is there anything else you need? Can I get you a magazine? I know it doesn't make any sense, but can I get you anything while I'm here? Your environment's clean. Bed's in a low position. Open the curtain. Go wash my hands. And then tell the evaluator my skill is done. Questions? Okay. So, call light goes in the bottom hand. So we now know all of the steps we need to do this particular skill. Let's check them off of our checklist to see how they're going to be applied. We're going to, oh, we've already done that. Hold on. Oh, I am on the wrong screen here. There we go. Okay, so we're going to follow, hit the wrong button. We're going to follow the care plan. We're going to do our opening and get those check marks. We're going to evaluate if we need gloves. We're going to use a privacy blanket. We're going to follow those linen rules. We're going to make sure the patient's always in the middle of the bed. We're going to do our skill-specific steps and then end with the closing. And if we do all of that, we're going to get all of those check marks and get 100% on this skill. Now, this care plan is only for this patient. It's not for this one. She gets out of bed and does everything herself. It's not for this one. He rolls. It's not for this one. I don't know why. This care plan is only for this patient. Every care plan that you have will be different for each patient you take care of. Good? Questions? All right. So Jake's going to show you this skill, and then we'll get into the next one. Good morning, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I need to turn you onto your left side and use some pillows to secure your position. Is that okay?
Yes.
Okay, I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. Now that I have clean hands, I'll get clean supplies. We're going to start with a barrier, and we'll place it on the overbed table. And this gives us a clean place to put our clean supplies. Now I'll get 3 pillows. And a privacy blanket. We'll bring this over to the side of the bed. Okay, Mr. Jones, I'm going to start with a privacy blanket. I'll place this on top of you to help protect your privacy and to keep you warm while we do this skill. So I'll take the privacy blanket and unfold it, being careful not to snap it or shake it. We'll lay it right over the patient on top of the sheet. Can you hold that for me? Thank you. I'm going to pull the sheet all the way down to the end of the bed. This just gets that sheet out of our way. Okay, Mr. Jones, can you scoot your body toward me? Thank you. Now I'm going to position you for the turn. So we're going to take the furthest arm and place it up over the head. The closest arm will cross the chest. The closest knee is going to bend with the foot flat on the bed. And then the furthest knee will angle out. Okay, just relax for me. Thank you. And now I'm going to roll you on your side on the count of 3. 1, 2, 3. So I'll roll the patient, maintaining a wide base of support. And then I'll use some pillows to keep him in this position. So the first pillow will go behind the back. The closest knee is going to bend with the foot flat on the bed. And then the furthest knee will angle out. Okay, just relax for me. Thank you. And now I'm going to roll you on your side on the count of 3. 1, 2, 3. So I'll roll the patient, maintaining a wide base of support. And then I'll use some pillows to keep him in this position. So the first pillow will go behind the back. We're going to move the privacy blanket out of our way so we don't tuck it in. The first pillow will go behind the back. We're going to tuck this edge underneath the patient. So I'm going to tuck down and under. This edge will roll up and then under the patient, down and under. And that provides a nice roll. We'll go to the other side of the bed. So this pillow will go between the legs, specifically between the knees and the ankles. We don't want the legs to lay right on top of each other, so I'm going to move the top leg just a little bit forward, and then I'll lift from below and place the pillow in between the legs. That way they're not laying right on top of each other, and the bony prominences are separated by the pillow. We'll cover the patient up. I'm going to take the third pillow, and this one will go underneath this top arm. As the arm droops down, this puts a lot of pressure along the upper back and into the neck. We need that arm in a neutral position. So I'll take the pillow, lift the arm from below, and place the pillow right under the elbow area of that top arm. Now the pillow under the head is under the bottom shoulder. So we're going to lift the head up move the pillow so that it's only supporting the head and neck, and then we'll place that bottom arm underneath the pillow. We're going to take the call light and place it directly in that bottom hand. Okay, Mr. Jones, I'm going to remove the blanket and pull the sheet up now. So we'll pull the sheet right up over the blanket and the pillows, and then remove that privacy blanket, rolling it into a ball as we remove it so that trailing edges don't contaminate other surfaces. We'll adjust the sheet for neatness and appearance. And we'll open the privacy curtain. Mr. Jones, are you comfortable?
Yes.
Okay, I'm going to go dispose of my linens and I'll be right back. This will go into dirty linen. We'll dispose of the barrier in the trash can. And we'll move the tray table back to storage. Okay, Mr. Jones, is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes.
Okay. Is the head of the bed, does it need to be adjusted at all?
No, thank you.
Your environment is clean. Bed is in the low position. I'm going to go wash my hands. After washing my hands, I'll review the care plan, make any corrections, and tell the evaluator my skill is done.
What the heck?
Hmm.
Now, I think the issue is a bandwidth problem
Yeah.
because the camera on the stream is still showing that the light's off. It's not catching up.
What's the bandwidth?
Internet.
Did we just lose all internet?
No, we're unconnected.
I'm very confused.
Well, we're going on break anyway, so let's go ahead and take our break. Those of you who are joining us virtually, you may see some things on the screen. We're going to try to get this worked out while we're on break, but we will take a 15-minute break. I see it. Reassociate the camera and StreamYard, please.
Already did.
There's a lot of What's that?
Repeat that one more time again.
Okay, I think we're good to go again. There's a lot of pieces to this technical puzzle. So when one goes down, we have to troubleshoot a big list. All right, so we're going to run into our next skill. This is foot care. Do you guys remember how to do hand and nail care?
Yes.
We're just going to do it lower. That's it. The one exception to that is that we are not going to do anything with the toenails. So with hand and nail care, we cleaned under the nails and we filed the edges. With toes, we don't do anything with toenails. So this is simply, no, we wash them, we rinse them, we dry them, and we look at them. And then we apply a little lotion, put the sock and shoe back on, and we are done. So this is actually a really easy skill as long as you can get on the floor. I cannot get on the floor anymore, so this is a hard skill for me. But overall, it's pretty easy, and you know all of the components to it. You see all the principles down here. They're all spelled out for us here, and we know all of them. We do have to learn our foot care specific steps. Short version of the skill up here, and then down here is our test specific information. Somebody with your level of experience, which is none, should be able to do this skill in 13 minutes or less. You're washing one foot, and they're giving you 13 minutes to do it. Don't rush. You got all the time you need. This is going to be done on a live testing student. That means that you may be a patient for this. There's a possibility that you may be a patient for this. Actually, for real, with water. Yeah, and I know, I mean, I am super ticklish. I mean, unbelievably ticklish. I might have a pedicure once every 5 or 6 years, maybe even longer, because you just look at my feet and I start giggling. So I get it. I get it. However, if you are picked to be a patient for this, please do the very best you can. Somebody else's grade is depending on your cooperation. You're in trouble. Yeah, because this is something that we do have to do in a clinical setting. And I'm going to explain to you why this is so important that we do it. So if you just don't like feet, this might be a problem for you. I would suggest maybe looking at work opportunities that aren't long-term care, because we're going to do this in long-term care. Okay. This person's going to be positioned in a chair. Documentation is not required. So up here on page 119, we have our care plan. We have step-by-step instructions. And then down here, we have our supplies. You do need to learn your supplies. Here's our care plan. Provide foot care to 1 foot using soap and water. How many feet are we washing?
1.
What if they have 2?
1.
1. It doesn't tell you right or left. You get to pick. The resident is sitting in a chair and their sock and shoes should be replaced at the end of the skill. Let me explain to you why that sentence is there. In a clinical setting, you are going to put clean socks on a clean foot. That makes sense. You don't get out of the shower and put your dirty clothes back on. Clean body gets clean clothes. In a clinical setting, a clean foot gets clean clothes. But during the test, this is done on another testing student. You aren't going to the test with an extra set of socks in your back pocket. We don't have socks to just give out during the test. So because of that, our care plan is telling us exactly what to do. What are we going to do? Put their sock back on them. Our care plan is telling us that. Remember, our care plans are specific to each specific patient. So that's what this specific patient needs, their old sock back on. Good? All right. We know all of this. We know to follow care plan. We know to do our opening. We know to evaluate gloves. Let's time out there for a second. We wear gloves if there's a possibility of touching body fluids, non-intact skin, or personal skin. Well, personal skin doesn't apply here. Feet are not personal unless you're on only feet. But non-intact skin, that could be a possibility. That's kind of the whole reason we're doing foot care, is to look for feet abnormalities, wounds, rashes, sores, ingrown toenails. We're looking for a problem. Since we don't know if there's a problem and feet are covered in shoes and socks before we ever get started, we will wear gloves for this, because the answer to that is maybe. Make sense? So we do need gloves for this skill. We're going to use a barrier. This time we'll put it on the floor. We're going to use our linen rules, washing rules, and basin cleaning. And of course, we're going to end with the closing. So let's learn our skill-specific steps. This is a lot like hand and nail care. So these were our steps for hand and nail care. These are our steps for foot care. We supported the wrist and arm at all times. We're going to support the foot and ankle at all times. Same. We soaked the hand in water. We're going to soak the foot in water. Same. We washed, rinsed, and dried. We're going to wash, rinse, and dry. Same. Starting to see a lot the same. Now, we cleaned under the nails. We're not going to do that for foot care. We filed the nails. We're not going to do that for foot care. What we are going to do is inspect all surfaces for wounds, rashes, sores, abnormalities, and that's really why we're there. Because feet are normally covered. They're normally hidden from view. And if your patient has some sort of a wound on their foot that they're not aware of, and I'm going to explain that in a minute, then it's up to us to uncover that foot periodically and take a quick look. And foot care gives us a reason to do so. Okay? Of course, we know no bare feet on the floor. We've heard that before. And we're going to replace the sock, removing wrinkles. Now, I do want to talk about this right here. No lotion between the toes. Now, we're going to lotion everywhere else, but not between the toes. Lotion holds in moisture. Now we have warm, dark, moist. Bacteria, pathogens, that's right. And we're setting our patient up for the development of something like athlete's foot. So no lotion between the toes, but lotion everywhere else. We clean between the toes. We dry between the toes. We just don't lotion between the toes. Good? So for this skill, our barrier is going to go on the floor. Our supplies will go on the barrier. Our basin goes on the barrier. And we put the foot in the water on the barrier. Everything is going to happen right here. Should I ever have that bare foot on the bare floor? No. We're going to support from below while we lift. And we're going to wash, rinse, and dry the entire foot just like we did the hand. We put the foot in the basin to wash, take it out and put it on a towel. I'm sorry. Put the foot in the basin to soak, then we take it out of the water and put it on a towel to wash. So we bring out our washcloth, no drippy wet washcloths, put some soap on the washcloth, and we wash the foot. We're going to put it back in the basin to rinse, just like we did with the hand. And then we're going to put it back on the towel to dry. Now, while you're there, you need to be looking. Anything I need to see, any redness, any wounds, anything standing out to us. If there is, what do we do? Tell the nurse. And I want you to tell the nurse now. I don't want you to finish up this skill, put their sock on, put their shoe on, take them to the activity room, and then go find the nurse and say, hey, Mr. Jones has got a great big sore on the bottom of his foot. Don't, because the nurse, what does the nurse have to do with that information? They have to look at it. If you've got the sock on and the shoe on and the patient in a whole nother place, how is the nurse going to look at that wound? You've covered it up. That means that you're going to have to go get that patient from the activity, take them back to their room, take their shoe off, take their sock off, and get them prepped for the nurse to come in and take a look. It's a whole lot of time wasted. Didn't you want a break today?
So we have to stop what we're doing and go.
Absolutely. Absolutely. And here's why. If the patient has a big wound on their foot, I may not want soap in that wound. I definitely don't want lotion in that wound. Right? So if you finish this skill and the patient's got a skin opening, you are now applying a treatment to a skin opening. You don't have the authority to do that. Does that make sense? Good? All right. So go let the nurse know while it's still open and visible, and let's get some new instructions here. We're going to apply lotion to the foot, but not between the toes. And our main job here is to look for abnormalities. Look for anything that looks weird, different, unusual. If it's red, report it. If there's a wound, report it. If the toenails are a bit long, report it. If the toes are so crossed over that you can't get a washcloth in between, report it. Whatever you see there, if it doesn't look normal, what do? Report it. Keep that foot on the barrier. We're going to put the patient's sock back on when we're all done and remove wrinkles. We just learned how bad wrinkles are. And then we'll secure the shoe like we are supposed to. So now we know all of these steps. We're going to use those steps to check off these checkpoints. So we're going to follow our care plan and get that checkpoint. We're going to do our opening and get those checkpoints. We're going to wear gloves because there's a maybe here and get those checkpoints. We're going to use a barrier on the floor and get those checkpoints. We're going to follow our linen rules like usual. We're going to use our washing rules. Look how many checkpoints we got for washing rules. Do you see that? We haven't even got to the skill yet. We're going to clean our basin the way we clean all basins, and we're going to get that checkpoint. And we're going to do our skill-specific steps to get those checkpoints. So are you seeing that the skill-specific steps don't give us a whole lot here? That most of our checkpoints are coming from our principles. Those are things that aren't on the care plan. Those are things you came to class to learn. Okay? And then, of course, we end every skill with the closing to get those checkpoints. Remember that this skill is only for this patient. This patient showers herself. We're not involved. This patient, we bathe in bed, but he never gets out of bed. So we see his feet all the time. All the time, because he's never out of bed. This patient, she goes to the salon once a week and gets a pedicure. So we let the salon handle that. Notice that each one of these has a different care plan based on their specific needs. This care plan is for this patient and this patient only. Every care plan will be different. Any questions on this? All right, let's go ahead and watch the video for this. Hopefully it looks like, keep your fingers crossed, everything is pretty stable right now. So let's see if we can keep this up. Hello, good afternoon, Mr. Jones. My name is Patty, and I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I'd like to perform foot care on your right foot per the care plan. Is that okay?
Yes.
Let me close your privacy curtain, wash my hands, and get my supplies, and I'll be right back. After washing my hands, we'll gather our supplies. We're going to start with a barrier on the floor under the patient's feet. So we'll spread the barrier out. And can you move your left foot to the side, please? Thank you. I'm just going to place this barrier on the floor. If you can lift your foot. Thank you very much. And we'll move that shoe out of the way. We'll also need a basin, soap, and lotion. Once the barrier is in place, we're going to get 1 towel and 2 washcloths and take them to the patient's area. You can place the barrier on the floor to kneel on, but this is optional. All right, Mr. Jones, I'm going to go get some water in the basin. I'm going to use a paper towel to turn the water on. Check the water temperature with the inside of my wrist. It should feel warm, not hot or cold, just warm. And we'll fill the basin about 1/4 of the way full. And then throw the paper towel away. Mr. Jones, would you like to check the water temperature?
Oh, that's beautiful.
Very good. I'm going to set this down. For this skill, I need 1 set of gloves. Go ahead and put my gloves on before we get started. And then I can take your sock off. We're just going to lift your foot and remove your sock. We'll set your sock to the side, being careful not to overextend, and place your foot into the basin. After your foot has soaked for a few moments, I'll place the washcloths in the basin and rinse your foot, and then lift the foot out and place it on the towel, wringing out one of the washcloths and applying soap. We'll apply soap to the top leaf and then wash all surfaces with short, soft strokes or a patting motion. We're going to wash down each one of the toes and then get in between the toes. And then gently we'll lift the foot with support and inspect the bottom of the foot while we wash all areas from top to bottom. And then we'll set this washcloth aside and place the foot back in the basin to rinse. We'll use the second washcloth to rinse the foot, squeezing the water to make sure that the foot has been rinsed well. I'm going to unfold the towel and lift the foot and place it on the towel to dry. We'll blot the foot dry around the ankle, the top of the foot, the heel of the foot, and then we'll lift the foot gently to dry the bottom. We'll take an edge of the towel and slide it gently in between each toe to blot to make sure no moisture remains behind. Now that the foot is dry, we'll get some lotion, warm it up in our hands, and then apply it to all areas of the foot except between the toes. So the top of the foot, the heel of the foot, and the sole of the foot, but not between the toes. And then we'll wipe off the excess lotion. The care plan has told us to replace the patient's sock. So once the lotion has been removed, I'll take the sock, make sure it's right side out, and scrunch it all the way up to the toe seam. We'll put the sock over the foot, making sure the toe seam lines up across the toes, and then we'll secure the sock over the heel, minimizing wrinkles and making sure the sock fits appropriately. And then we can gather our dirty linens and place them in the soiled linen hamper. So we'll place our soiled linens in the soiled linen hamper. Now we can clean our basin. I'll bring the basin to the sink. We will dispose of the water in the sink, rinse the basin, and then dispose of the rinse water in the sink as well. I'm going to set the basin down, disinfect it per facility policy, and then use a paper towel to pick it up. We'll dry the inside with a paper towel. Throw that paper towel away. Dry the outside with a paper towel and throw that paper towel away. And then get one more for the drawer. After cleaning the basin, we'll use the paper towel to pick up the soap and the lotion and return the basin to storage. We're going to put our supplies away by opening the drawer with a paper towel. We're going to put the basin, soap, and lotion in the drawer, close the drawer with a paper towel, and then we'll throw the paper towels away. And then we'll remove our gloves, being careful not to contaminate our hands. So now I'm going to gather the barrier, and we'll throw this away, and I'll help you put your shoe back on. There you go. Are you comfortable?
Yes.
Is there anything else I can get for you while I'm here?
No, thank you.
Would you like a magazine before I go?
No, thank you.
Your environment is clean. I'm going to go open the curtain and give you your call light.
Thank you.
Okay, Mr. Jones, here's your call light. If you should need anything at all, just press that red button. I'll be happy to come back and help you.
Thank you.
Is there anything else I can get for you before I wash my hands?
No, thank you.
Okay, have a great day. I'm going to go wash my hands. After washing my hands, I'll review the care plan, make any corrections, and tell the evaluator my skill is done. All right, any questions on that? That really is one of the easier skills, other than the fact that you have to get on the floor to do it. But all you're doing is washing a foot, rinsing a foot, drying a foot, lotioning a foot, and looking at it. There's really not much to that particular skill. As long as you remember all of your washing rules. Remember that we use a paper towel to turn the water on. We check it. We let them check it. Whatever we wash, we rinse. Whatever we rinse, we dry. No soap in the basin, so you keep your water clean for rinsing. If you can remember that, the skill is pretty easy. Any questions? All right, so now we're going to move on to mouth care. Again, another easy skill. You guys all have experience brushing teeth. This is not a new to you skill. So if you look on page 92, We have our principles down the side here. They're all spelled out for us here. Again, there's nothing new to learn. We know skill rules. We know the opening. We know glove rules. We know to use a barrier. We know linen rules. We know how to clean a basin, and we know how to do our closing. Nothing new here to learn. Down here at the bottom, you can see your test-specific information. Somebody with your level of experience, which is none, should be able to brush somebody's teeth in 12 minutes. Way more time than you. How many of you guys take 12 minutes to brush your teeth? Way more time than you need. Okay. Now, I'm also going to tell you that on the checklist, there is nothing that says you have to brush the teeth for a specific amount of time. You don't have to be brushing for 2 minutes. That's not what the test is about. They just want to make sure you get all surfaces. So it does not take 12 minutes to do this skill. Take your time. Don't rush this. This will be done on another testing student. What does that mean? You might be a patient for somebody to brush your teeth. Go to your happy place, right? Nobody wants a stranger in their mouth. Nobody. If I came to your house at 6 o'clock tomorrow morning and you're able to brush your own teeth and I'm armed with a toothbrush and some toothpaste and I say open wide, you're going to tell me you're crazy, get away from me, go away. You, as long as you're able to brush your own teeth, will brush your own teeth. You do not like strangers doing this skill on you. So as long as your patient is able to brush your own teeth, they will. We're not going to brush everybody's teeth. People that can brush their own will continue to brush their own. Does that make sense? Okay. This person will be positioned in bed like this. Here's our test-specific instructions, care plan at the top, step-by-step instructions here, supplies down here. You do need to learn your supplies. Here's your care plan. A resident with natural teeth is lying in bed and needs mouth care. The resident is not able to provide their own mouth care. That's everything we need to know. They're laying in bed, they need their teeth brushed, and it's their natural teeth. Somebody in here is going to go, but wait, what if they have dentures? We have a whole nother skill for that coming up next week. Stay tuned. We know all of these, so let's learn this. And I guarantee you there's not much here that you already don't know. First thing we have to think about is the position the patient is in for mouth care. This is not a safe position. We need to get the head of the bed up. So we're going to put the head of the bed up. That is a tested checkpoint, getting the head of the bed up. But we kind of have to think about when we want to do that. Is that bed controller clean, do you think?
No.
No. So we have to consider this, right? Would you want me to touch that bed controller and then use those same hands to brush your teeth? No, it's kind of high on my gross meter, right? We know that's not clean. We really, So remember way back in class 1, we learned that the first, well, I'm trying to figure out how to say this. You can't touch the patient until your hands are clean. Okay. So we have that as a rule. We can't ever break that rule. You can't touch the patient until your hands are clean. So if you put the head of the bed up before you wash your hands, which makes sense, right? We want to wash our hands after we put the head of the bed up. So we touch a controller, the head of the bed goes up, we go wash our hands. Here's the problem with that. When you're laying down, that pillow is very comfortable behind your head. It serves a purpose, but when you put the head of the bed up, that pillow forces your head forward. This is not a comfortable position any longer. Does that make sense? Okay. So what we need is that pillow either out from behind the head, or better, have them lean their body forward and pull the pillow down behind their upper back, and it gets them sitting up a lot straighter. Can we touch that patient before we wash our hands? So that poses a problem. If we put the head of the bed up before we wash our hands, our patient's going to be uncomfortable. If we touch the controller after we've washed our hands, we contaminated our hands. So what is something that we could put between our clean hands and the dirty controller? A paper towel. Absolutely. Good? Make sense? Okay. So remember that you have to have clean hands before you touch that patient. Very important. So if you look on the step-by-step instructions here, you'll see that I use a paper towel as a barrier to raise the head of the bed to a full sitting position and then adjust that pillow behind them. So these step-by-step instructions address this. But I want to point this out because this messes students up. Does it matter when you do this? No, it doesn't. After you've washed your hands, if you want to get your supplies first and then put the head of the bed up, that's fine. If you want to put the head of the bed up first, that's fine. That order does not matter. Good? Make sense? Okay? All right. Now, when you brush your teeth at home, you probably do so over a sink, but you probably aren't in this position. When you brush your teeth, you're in this position. Do you guys know why? Yeah, you don't want all that stuff over your clothing. So you bend forward a little bit over the sink. This patient is sitting up in bed. They're not leaning forward. So that means that whatever comes out of their mouth is going to get all over their clothing. So what is something we can put over their clothing to help protect it from that toothpaste?
Towel or barrier.
Yeah, a towel, a barrier, a washcloth, a paper towel. I don't care what you use. Kleenex. Put something on their clothes so they don't get toothpaste stains all over. We always wet our toothbrushes before we put toothpaste on. Same principle as hand washing. Remember how we had to wet our hands before we put soap on so the soap spread around? Same thing. We wet our toothbrushes before we put toothpaste on to spread that toothpaste around more effectively. And then you're going to brush. That's it. This is the whole checkpoint. Brush sides and biting surfaces of teeth and gum line with a gentle motion. It doesn't say you have to go back and forth. Doesn't say to go up and down. It doesn't say to go in circles. It just says brush. So a lot of people get all hung up in these details. Oh no, you have to do this. And oh no, you have. Remember I said on testing day, you're going to get a lot of input. Yeah. What does the checkpoint say? Brush. Got it? Remember, there are some teachers out there that overly complicate this stuff. Our checkpoint's very simple here. Just brush. Just brush. Once you've got all of the surfaces covered, then they have to be able to rinse and spit. Now, I'm going to give you a little secret. You probably use too much toothpaste at home. You probably do. If you look at the package, it says a pea-size amount. But if you look at the advertisements, have you ever watched a toothpaste commercial? They don't use a pea-size amount. They do this whole big loopy stripe thing. It looks so pretty on advertisements, doesn't it? Do you know why they do that? The package tells you how to use it, but advertisements show you this big old stripe on your toothbrush because they know that you will follow what you see rather than what you read. So when you're at home, you're going to put a big old stripe of toothpaste on your toothbrush, thinking that that's the right way to do it because that's what you saw in the commercials and in the magazines, right? Now, why would they do that? That's right, because the more toothpaste you use, the more often you have to buy it, the more they get to make. That's correct. Marketing, gotta love it. Reaching their hands in our wallets 24/7. They do. Now, why am I bringing this up? Because the more toothpaste you use when you're brushing somebody's teeth, the more they have to rinse and spit. You'll be here for 5 minutes if you use a big old stripe of toothpaste. Yeah, you do have 12 minutes. Yeah, true. Use a little bit. That's all you need. Just a pea-size amount is all you need, especially if your patient has swallowing difficulties. This becomes a safety issue if your patient has swallowing difficulties, because when we're rinsing with non-thickened water, and that water can go down the esophagus, because if we have swallowing difficulties, we have no esophageal tone. So that water goes down the esophagus, can cause choking, aspiration, and other issues. A little bit of toothpaste is all we need here. Good? Make sense? All right. Just let them rinse as much as they need to. There's no right amount. There's no wrong amount. Just let them rinse as much as they need to. But here's an important step that everybody misses. This is the most missed step on mouth care. Dry their face. I don't know why, but it is the most missed step on mouth care and denture care, because you get so wrapped up in your steps that you forget to look at that patient, and they're a drippy, wet mess. And you won't pay a bit of attention. You'll just start cleaning up. Right? That patient is sitting there, a drippy, wet mess. Do you think they feel comfortable like that? Take a minute and look at your patient. When you're done rinsing, look at them. Oh, ooh, let's do something with that. Let's dry it off. Let's get you buttoned up. Okay? Be very, very aware of your patient's perception for this skill. Common question, are you going to brush everybody's teeth? The answer is no. We're only going to brush teeth of the people on the care plan that have that order us to brush their teeth. Now we know these steps. That's it. That's mouth care. We know the steps. So we're going to use those steps to get these check marks. We're going to follow the care plan. We're going to do our opening. We're going to wear gloves for this because it's body fluids. We're going to use a barrier to keep our supplies clean. We're going to use linen rules. Don't hold them up against our uniform. Don't throw them on the floor. What's the only thing that can go on the floor? Shoes. All right. You're going to clean your basin like we clean all basins. Rinse it, dry it, put it away. You're going to do your skill-specific steps, okay? And then you're going to do your closing. That's the whole skill. This is, I think, one of the easier skills because it's something you guys are already familiar with. You know these steps. You're just doing it on somebody else. So now we have to think about safety, get them sitting up. And we have to think about infection control. Don't bring something to this patient they don't already have. Sound good? Other than that, I think this is a pretty easy skill. Now remember that this skill is only for this patient. This patient, she brushes her own teeth. She doesn't need you. This one has dentures, something totally different we're going to learn next week. And this guy, he needs our help, but he brushes his own teeth, bless you. We just have to squeeze the toothpaste for him because he can't squeeze anymore. So his care plan says something different. Good? Everybody has a different care plan. All right, Jake's going to show us this video. And when we're done with this one, we're going to do one more skill, respirations, and then we're going to go over test registration instructions. Moving right along today.
Hello.
Good morning, Mr. Jones. How are you?
I'm well. How are you?
Fantastic. I'd like to perform mouth care on you. Is that okay?
Yes.
I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. I'm going to use a paper towel as a barrier to put the head of the bed up, since my hands are clean and the bed controller is not. Once we get the patient to an upright sitting position, I can throw the barrier away and then adjust the pillow so it's a little more behind his back rather than his head. There we go. Good?
Yes.
Okay, let me go get the rest of my supplies and I'll be right back. I'll gather my supplies. We're going to start with a barrier, and that gives us a clean place to place our clean supplies. So we're going to open the barrier up. And I also need a towel. We're going to get an emesis basin, a toothbrush, toothpaste, and a cup of water. And we also need a pair of gloves. I'm going to get my toothbrush prepared by wetting it and putting toothpaste on, and then storing it in the emesis basin until I'm ready to use it. Mr. Jones, can I place this towel over your chest?
Yes, please.
Thank you. This is just going to help keep your clothing clean. I'll put my gloves on. And now we're ready to brush your teeth. I'm going to brush the top, the bottom, the front, the back, and your tongue. So can you open wide for me? I'll start in the back, on the top, both sides, and then the bottom, both sides, the front, both top and bottom. And can you bring your teeth together? Thank you very much. And then stick your tongue out. Thank you. I'll set this aside, and now we can rinse. Go ahead and take a sip. Another sip.
Yes, please.
Okay. I'll pour the water in the emesis basin, set them on the table, and then I'll take this towel away and put it in dirty linen. I'm going to go clean my basin. We'll clean the emesis basin by dumping the saliva into the sink, rinsing the basin, setting it down, and disinfecting per facility policy. Then we'll take a paper towel to pick it up, a paper towel to dry the inside. We'll throw that paper towel away. Paper towel to dry the outside, throw that paper towel away, and one for the drawer. Now I can return the basin to storage, putting the toothpaste in the basin and using a paper towel to open the drawer to store the basin back in it. We'll close the drawer with a paper towel and then throw those paper towels away. All of these disposables will be disposed of. I'm going to go throw this away. I'll be right back.
Okay.
Now I can remove my gloves. Okay, Mr. Jones, is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes.
Okay. Bed is in the low position. Your environment is clean. Let me get your call light for you. Would you like a magazine before I go?
No, thank you.
Okay. Here's your call light. If you need anything at all, just press that red button. We'll be happy to come in and help. I'm going to go open your curtain and wash my hands. After washing my hands, I'll review the care plan, make any corrections, and then tell the evaluator my skill is done. All right. Last skill for today. After this, we are half done with the program. Easiest portion is coming up. Okay. Fritz says, thank you so much. I had this skill, mouth care, yesterday, and I passed. Congratulations to you. Great job. Great job. Thank you for coming back and telling us so we could congratulate you. Welcome to healthcare. Okay, so this is an easy skill. Respirations is breathing. We're counting somebody's breathing. From the outside, it looks a whole lot like pulse. Okay, if you just watch the video without any sound, it would sound a whole lot, or it would look a whole lot like pulse. And I'm going to tell you why in just a minute. That's actually a very important component to this. But this is an easy skill. It's very short. You have 5 minutes to get this done. We know the principles involved. Here they are, skill rules. So we follow the care plan. We do the opening. We evaluate if we need gloves, and we do the closing. Nothing special with this. Down here tells you test-specific information. Somebody with your level of experience, which is none, has 5 minutes to get this done. It's going to be another testing student because mannequins don't breathe. That person will be in bed. Charting is required for this skill. And normal respirations are between 12 and 20. That's what we're hoping for, between 12 and 20. You can be off by 2 breaths in either direction, though. Let me tell you something about vital signs. As CNAs, when we take vital signs, we are taking what's called baseline vital signs. This is a patient in a normal resting condition, okay? So if your patient just ate, that's going to affect their vital signs. If they just drank, that's going to affect their vital signs. If they just came back from an activity, that's going to affect their vital signs. We want a patient who has had at least 15 minutes of nothing before we take their vital signs. If a patient just comes back from an activity and we take their vital signs and we get an abnormal reading, we should wait about 20 minutes, 15 to 20 minutes, and then recheck it to see, is this a change that was brought on by that activity, or is this a true change that needs to be reported? Does that make sense? Okay. So baseline vital signs is the patient in a resting condition. Keep that in mind. CNAs don't take any other kind of vital signs. Remember, we do normal. Normal is a routine task on a stable patient that we've been trained to do according to the care plan. Baseline is a stable patient. Okay, make sense? Okay. You can see the documentation form on the next page right here. You also have a full page version of this on page 168 in your book as well. Care plans at the top, supplies are at the bottom. Supplies are easy for this. And here's our care plan. It says patient will be lying in bed for skill. Count the patient's respirations for 1 full minute and record your readings. How long are we counting? 1 full minute. Why? It's what the care plan says. I don't care if Aunt Martha tells you we only count for 15 seconds and multiply that by 4. I don't care if the CNA that's precepting you tells you, yeah, we just write 16 for everybody. Oh, yeah, that happens. Absolutely. People make up respiration rates all the time. I only count if they look like they're in distress. I use 16 for everything. Yeah, I know, because when I'm looking at your vital signs and I see 16 all the way down, I know you didn't do your job. And that's probably going to reflect on the pay raise that you don't get. If I ask you to take respirations, it's because I'm concerned there's something going on with the patient. I need you to be my eyes. Make sense? Good? Yeah, you will hear that when you're out there. You will hear that. Okay, so we're going to learn our test-specific steps because we know all the rest. So the first thing is when we're counting respirations, we do not want to tell this patient that we're counting their breathing, because if I tell you I'm counting your breathing, ready, set, go, you will do one of two things. You will either hold your breath or you'll start breathing faster because now you know you're being watched and you're anxious, and that increases your respiration rate. When you know you're being watched, you become anxious. Good? So I don't want to tell this person I'm counting their breathing. What I'm going to say is I'm going to take your vital signs. I'm not lying. Respirations is a vital sign. I'm just not telling them which vital sign I'm focused in on. Make sense? Okay. In and out counts as one cycle. So that was one breath. That was another breath. Got it? In and out counts as one. So that whole thing counts as one. So if you start counting and the patient is in the middle of that cycle, it counts. Make sense? Because the whole thing counts as one. So you don't have to wait for them to start an inhale to start counting. Wherever they are in the cycle, it counts. Good? Make sense? Okay, our care plan is telling us 1 full minute. We're going to count for 1 full minute. But in a clinical setting, if our care plan doesn't say 1 full minute, we are allowed to use that whole shortcut thing that we learned with Pulse. Count for 15 seconds, multiply that by 4 to get our full minute. Same thing. But not for this patient, because this care plan says count for 1 full minute. Normal is between 12 and 20. The evaluator has to count 2. So during this skill, just like Pulse, you are going to say out loud, start. And then I'm going to count whatever the patient breathes until that second hand gets all the way back around to the 12. And then I'm going to say stop. And the evaluator will count during that same time period that I'm counting and get the same result, hopefully. Now, we can be off by 2 breaths in either direction and still be considered accurate. We do have to document for this skill. So we're going to do our closing. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Environment's clean, bed's in low position. Here's your call light. Open your curtain, wash my hands, and then document. And then I have to wash my hands again. Good? All right. One other thing that makes this skill different from every other skill that we do. If I'm counting this patient's respirations, okay, and I do this, start. How comfortable do you think this patient is right now? I'm in their space and I'm staring at their chest without speaking and without touching them. This is very high on the creep meter. So I don't want to do that to this patient. It's going to make them anxious. They don't know what they're supposed to be doing during this time. What are you waiting on? Why are you looking at me? What is going on? Am I dying and nobody told me? What's happening here? Their anxiety will go up and that makes them breathe faster. Am I going to get an accurate reading? No. So I already told this person that I want to take their vital signs. So what I'm going to do is set this up and make the patient think that I'm taking their pulse. So this is awkward. This is natural. Do you guys see the difference there? I am not doing anything here. I'm literally holding her hand. She doesn't know that. But I'm focused on the breathing. In and out counts as 1. Now, there's something you can do to make this easier for you to see. Should have a slide on this. No? No. Okay. There's something you can do to make this easier for you to see the breathing. And that is in your drawer or on top of the drawer, either way at the testing center, you will have alcohol pads. Now, when you place an alcohol pad on the patient's tummy, it's going to magnify the motion. I did not change her breathing. What I changed was my ability to see it. I use psychology because our eye is drawn to movement when it's a contrasting color. This is what kept us safe from saber-toothed tigers, okay? When we see a contrasting color moving, it captures our attention. So I just set an alcohol pad on her tummy, and as her tummy moves with the breathing, I can see it easier. But so can the evaluator. So that keeps the evaluator over there against the wall, out of my space, not breathing down my neck for the test. Everybody is happy with that. So for the test, use an alcohol pad, just lay it on their tummy, and you're going to count what you see because now you'll be able to see the rise and fall of the breathing a lot easier. Now, if your patient asks, what is that there for? You give them a non-answer. I just need that for later. Now, the thing about alcohol pads is they're mystical, magical, and medical. Patients are familiar with alcohol pads. So you just throw it on their tummy. If they say why, you say, oh, I need that later. And they'll go, okay. They're very compliant with alcohol. Now, if I put anything else on her tummy, she's going to have questions. But if I put an alcohol pad there, she's going to think, they're going to use it later. It's okay. It's not threatening to them. We use alcohol pads because they're colored, so it's easy to see, but also they're disposable. We just toss them when we're done with them. They're cheap. You can use this on the state exam.
So every time you close off, your alcohol is like 1, 2,
In and out, right.
3.
Right. Yep. In and out counts as 1. So if you want to count up, that's fine. If you want to count it when it goes down, that's fine. So, because the whole thing counts as 1. Now, I'm going to show you this video, okay? And remember Pulse? Remember when we were watching Pulse, we had the words on the bottom of the screen that got bigger and smaller when I felt thumps under my finger? We do the same thing with respirations, okay? You're going to see in and out. Okay, so the words are going to get bigger and smaller. You'll also see the alcohol pad being able to go up and down. So you can count along with me for this skill. Okay. So this skill, let's real quick. Documentation principles on page 48, you can read on your own. It just kind of tells you a little bit about documenting as a CNA. You will need that information on the written test. So you can read that on your own. So now we know the steps. Let's check off our checklist here. We're going to follow the care plan. We're going to do our opening. We're going to evaluate if we need gloves. You probably won't. 99% of the time you won't. But if she's got a rash on her arm that I'm going to be holding, do I need gloves? Yes. So we'll evaluate if we need gloves. We're going to do our test-specific step. Now, I want you to pay attention to this real quick. You see this whole checklist? Right? Most of the checklists that we've seen up until now have quite a bit of black on there. That's our skill-specific steps. Look at this. One step. The skill is not about counting the respirations. This skill is about following the care plan. This skill is about how you relate to the patient. This skill is about making them comfortable and letting them know what you're doing. This skill is about ending the skill properly and documenting. This skill is not about measuring respirations. That's what we're going to do to show all of this other thing. Does that make sense? And then we're going to do our closing and get those check marks. This care plan is only for that patient. That's it. It's not for these guys. These guys have different care plans for respirations. This one, we don't count at all. He's never had a respiration issue. He is good. We are not counting his respirations ever. This one, we count her respirations, but we do it every day before respiratory therapy shows up at 9 a.m. Good? Make sense? This one, we count our respirations once a week, but we just do routine, 15 seconds, multiply that by 4 just to get a baseline. Good? Everybody is different. All right, so Jake's going to show you this skill. Remember, you're going to count with me on the scale. While this video is playing, he's going to be passing out the test registration forms. Don't do anything with them. I have to go through every aspect of this with you step by step to make sure that you get the right things in the right place.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I need to get your vital signs. Is that okay?
Yes.
I'm going to close your curtain. Let me go wash my hands, and I'll be right back. Okay, Mr. Jones, I'm just going to lay this on your stomach for later. I'm going to elevate your forearm, keeping your elbow on the bed. And this will take me about a minute. I'll need you to remain quiet during that time, but I'll let you know as soon as I'm done, okay? And we're going to start. Ready, set, start. Stop. Thank you very much, Mr. Jones. Is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes, ma'am.
Would you like a magazine before I go?
No, thank you.
Okay, bed's in the low position. The environment is clean. Here's your call light. If you need anything at all, just press that red button. We'll be happy to help you. I'm going to go ahead and open the curtain and throw my alcohol pad away and wash my hands. After washing my hands, I'm going to document on the sheet provided by the evaluator and then wash my hands again. After washing my hands a final time, I'm going to review the care plan, think about my skill, make any corrections, and then tell the evaluator my skill is done. Any questions on that one?
I wasn't counting the letters. I was counting that, you know,
The breaths?
and I count 14.
I got 12.
Okay.
Yeah, 12. Okay.
So 12 was what I documented. That was the correct answer. If you got 10, 11, 12, 13, or 14, you are accurate. Okay. because you can be off by 2 breaths in either direction on the state exam. Questions on that one? Super easy skill. It is also the skill that is on the most testing care plan sets. Remember, there's 11 of these, and the test is going to pick one for you. Well, respirations, turn to page 25 in your book. Let me show you. Turn to page 25 in your book. On page 25 in your book, look at the first care plan. Look at the third care plan. The third, on the top row, look at the third one. In the middle, it says measure and record respirations. Look at the last one in the middle row, measure and record respirations. And then look at the one, not the very last one, but the one right next to the very last one, measure and record respirations. So out of these 11, 5 of them have respirations on it. This is the most assigned skill on the state exam. Good? Okay. All right, so we're going to jump into test registration now. If you go to my main website, foryourcna.com, this is the main website. Up in the top menu, you're going to see home CNA training. That's what you're doing now. You're in training. Everything you need on this website right now is under training. So these are the skills videos, the animated lessons, the practice test, everything that you need in training is under training. Then we have the online test prep course, which you guys are all enrolled in. So if you click on that, it'll take you to the course. And then you have testing. Well, that's coming up for you. Right now you're in training, but testing is coming up. So everything related to testing is going to be under that menu. And what I want you to pay attention to is test registration instructions. I also have a page on background screening and another one on criminal background. So if you have a criminal background, you're probably going to want to read that. If you have questions about the background screening, you're probably going to want to go to that page. Okay, good. There are 4 steps to registering for Prometric State Exam. The first step is obtain a background check. Now, I know that some of you work in healthcare already and you think, I've got a background check. I can skip that step. Let me say this clearly. There are 4 steps to registering for the CNA test. The first step is to get a background check. It doesn't say, do you have one? There are 4 steps, and the first one is get a background check done. Do you guys understand that? I don't care if you have one. The test doesn't care if you have one. The state statutes are very explicit on this. You must get a new background check when you register for the exam. Now, I got a lot of pushback on this from students. So I went to the Board of Nursing's website. These are screenshots from the actual Board of Nursing's website, which is floridasnursing.gov. Okay. On their website, if you go to their FAQs, frequently asked questions, this is addressed in 2 separate places. And it says a new background check is required on all new applications for the CNA exam. It also says a new background check is required at the time of application. So everybody asks this question a million times. It's already been answered.
Okay. So we have to go to the first one?
No,
Get one?
I'm proving to you, I'm going to tell you how to get it in a minute. I'm just proving to you that you need one. because some of you will argue with me and tell me you've already had one. And I'm telling you, you need one.
Okay, but you know where can we get one?
I'm going to go
Okay,
step by step. I'm going to tell you exactly how to get it. Good. So there's 4 steps to test registration. The first is get the background check. But when you get a background check done, they're not going to give you anything. You get nothing. You go to the appointment. They take your fingerprints. They take your picture. You sign. That's it. You've done your background check. They don't give you anything. You don't send your background anywhere. You just go to the appointment. Last class, I had somebody that contacted me like last week and said, I'm still waiting for them to send me something on my background. They won't send you anything. It goes to the clearinghouse. This is called chain of custody. Everybody has a cell phone now. You have the ability to edit a photo. Whether you know how or not is irrelevant. You have the ability to edit a photo. So if they send you your background check, you can edit it and send it somewhere. You cannot have access to your background check. You can't have any influence on your background check. Does that make sense? Good. Okay, so step 1, we're going to get that background check done. Okay, so how do we get a background check? Well, on the back of this tells us how to do it. Now, there's a million background check vendors out there, a million. You can go to Florida's healthsource.gov and look up all of the background check providers. I think I've got that on here. No, I don't. And look up all the background check providers. I have found that this one has the least cost in our area and the fastest processing in our area. I have had students that use the sheriff's department, and it took 3 to 4 months for their background check to get cleared. I have people that use employer services and paid $150 for a background check. So I have heard them all. You use who you want to use. I'm not here to tell you who to use, but I am going to tell you that these people are cheaper than everybody else. And your background check is in within 24 hours. So that's who I don't get a kickback. I've not partnered with them. I get nothing from this. I'm giving this information to you. Okay. So who we recommend is DTIS. You go there, you have to create an account. They use the UPS store at Barclay in Spring Hill Drive, right next to that Publix, by the Parkway. Take Spring Hill Drive out to the Parkway. Anybody know where I'm pointing at? By the Parkway. If you take Spring Hill Drive out toward the Parkway, when you're almost to the Parkway, there's a 7-Eleven and a Wendy's. There's Publix and Beef O'Brady's.
Oh, okay, way on that.
Anderson Snow Road.
Yeah,
Anderson
Anderson
Snow.
Snow. Yep. Yep. So that's where this location is. Okay, good. You have to make an appointment online. If you just walk in, and you can, lots of UPS stores will let you just walk in, but they're going to charge you more. It's like $25 more. I know, it's crazy, crazy. Just apply online. Just do this online. You usually can get an appointment the same day if you go online. But this tells you exactly how to do it. Tells you the website to go to. You're going to click create an account. You're going to click create application. And then you're going to click Florida services. You just follow this step by step, and you will be able to register with no problem. You have to have this ORI code. It's EDOH0380Z. You use this code when it asks you for the ORI code. Follow these instructions, and registration takes less than 2 minutes. You're going to put your credit card information in and pay for it. And I think it's like $78.25 or something, where if you get it done, if you just walk in, it's over 100. And then there's some other people that were doing it. Someone in my last class went through them because it was like a friend of a friend or type situation, referral type situation. And they paid like $150. So if you got that much extra money, let me know. I got some things I can sell you. All right, so let me explain to you what's happening here. So this tells you exactly how to get your background check done. And give it 24 hours. So do the background check, wait 24 hours, and then we're going to apply for the test. Now, let me explain what's happening in that time frame, right? Because I want you to wait that 24 hours. When you get your background check done, it has to go to a place called the clearinghouse. The clearinghouse holds all background checks for medical professionals. Nobody in here is in law enforcement. Nobody in here works for daycare. Nobody in here works for banks. This is just for medical. Nobody in here, you have to be careful because if you're working in assisted living, you think you're in the clearinghouse. You probably aren't. You are in the ACA filing cabinet. Agency for Healthcare Administration, different agency. So this is why I'm saying you have to get that background check done. You think that you're working for medical, you're not. You're working for personal care services. Different filing cabinet. So you get your background check done and it goes into the clearinghouse. You're not going to get anything. It just automatically goes there, but it takes a little bit of time to get there. Now, once you do that, then you apply for the test. Now, it's important that you do it in this order, and this is why. I know it looks complex, I'm going to walk you through it. You get your background check, and now you are in the clearinghouse. Good job. You then apply to Prometric for the test. Once Prometric gets your application, they go to the clearinghouse, and they say, hey, we need this person's background check. And the clearinghouse gives it to them. They then put your application and your background check together and make a packet. And they deliver that packet to the Board of Nursing. Got it? So if you don't do this, if you just apply for the test, when Prometric goes here to get your background check, they're not going to find it. And then they're going to send you a letter, and the letter doesn't tell you anything. It has one box. And if you don't know how to read these boxes, you're like, what does that mean? It just says application status incomplete. This is what it looks like. This is what the form looks like. Doesn't really look like much of anything. Yeah, thanks. Doesn't really look like much of anything. It just has a whole bunch of boxes. You don't know how to read this. There's one line here that says application status, and you want to make sure it says complete. I know it's really blurry, but you want to make sure it says complete. If you get this back and that says incomplete, that means they weren't able to find your background check or your payment didn't clear. Okay, I'll pass this around so you guys can see. Good? Make sense? Do you understand the process here? That's why we're going to do our background check and wait 24 hours. You probably could get away with 3 or 4 hours, but let's give them time to do their stuff. Then we apply for Prometric. Prometric pulls that application, pulls that background check, puts it with the application, and then sends it off to the Board of Nursing. Now, the Board of Nursing has a role here to play. And it's important that you understand that this is not a computerized system. This is still a human system. So the Board of Nursing gets your packet. and it has your application and it has your background check. And a human, a real live human, has to look at the two of them and make sure that you are safe to leave a home alone with grandma. That's what they're looking at. Is if we give you a CNA certification, that means that we're saying that you can go to work in people's homes and we know those people will be safe with you. And that's what they're looking at when they look at your background check. So if you had one shoplifting charge when you were 16 years old because you were young and dumb and you got caught, everybody was young and dumb, just not everybody got caught. Okay. So you were young and dumb and you got caught, and it's been 10 years and you did everything you were supposed to do. Your background is clean since then. You were just stupid on a dare, right? They're going to look at that way different than if you have 33 shoplifting charges and the last one was 3 weeks ago. Do you think that person should be allowed unsupervised in grandma's house next to grandma's checkbook and credit cards and candlesticks? That's what they're looking at here. If you have a violent tendency, if you think the solution to all of your conflicts are fists, we probably don't want you working with at-risk individuals. Well, that makes sense. So they look at your background check and evaluate whether you would be a good fit for healthcare. And they do look at it in terms of the patient's safety. It's not, oh, well, I only had 3 charges. It has nothing to do with you. It has everything to do with, is this patient going to be safe with you? That's what they look at. But it's not like an automatic process. Okay, there's a person involved. They look at that and they think, okay, wait, I got a question. This is a little iffy, right? This is, so then they may send you a letter that says, hey, I want some more information on this. Okay. So like, yeah, you had a DUI, but it was only 9 months ago. I got some questions, right? So they're going to ask you for information. They're going to make sure that you paid your restitution, that you did your community service or whatever you needed to do, that the case is closed, you're no longer on probation, yada, 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 right? They're going to make sure that you have fulfilled the terms of whatever it is that you're in trouble for. And then if they still have questions, they're going to invite you to come to the Board of Nursing meeting. And the Board of Nursing meets every other month. And they're going to say, hey, yeah, we still have a few questions. We'd like to meet with you face to face. So they ask you to come to the board and they say, hey, tell us your side of the story. What happened here? You know, what happened? And if it was something like, yeah, I made a huge mistake. My mom had a heart attack. She was in the hospital. I was at Applebee's enjoying happy hour. I made a bad decision. I got in the car because I was going to the hospital to see my mom and I got caught. Okay, that's way different than I got 5 DUIs behind me. The last one was 9 months ago, but yeah, I've learned my lesson. Probably not. Do you guys see how they're going to evaluate everybody's situation independently? I can't tell you whether your particular situation is going to be approved or not, because I don't know. I'm not the one that makes the decision. It's a human that makes that decision. I don't know where they're going to be at that particular day mentally. There is no way to pre-screen. You follow this process. You do your background check. You apply for the test. And then you wait to hear back from them. If they want more information, they're going to contact you and say, hey, provide some more information. If they want to meet you, they're going to send you a letter. Hey, we want to meet you. Most of the time, it just says approved. Most of the time, it just says approved. And they give you an opportunity to take a test. If you pass, you're a CNA. Congratulations. But there's no way to pre-screen this. You can't contact the Board of Nursing and say, hey, I'm looking to take a class, but I don't want to invest in the class. I don't want to pay for the test unless I know that I'm going to be able to test. The Board of Nursing they're not going to answer that. They're going to tell you, go through the steps. Go through the steps. We're not doing this for free. It's your background. That's your problem. We're not doing this for free. Go through the steps. Make sense? Question? Okay. I lost my drink. All right. So once we've done the background check and we understand the steps, now we're going to do the test registration. So all of you have a packet in front of you. Some of you, we printed single side. Some of you have a double-sided. It's the same application. There's 2 ways to apply for the test. We recommend online application, but you have the paper application if you want to fill this out and send it in. This has the new address. Prometric moved in November. This has the new address. So make sure you use this address to send your application if you're going to mail it in. But there's 2 ways to apply. If you go to Prometric's website, which is right here in the top, says prometric.com/nurseaid/FL for Florida. Good. Go to that website. Let me go back a page. This is what it looks like. You want to open up application process. And then you'll see 2 links, online and paper. This is where I got the paper application from. Good. We recommend that you do this one. This is this. It looks exactly the same. There are three exceptions. 3 things we're going to talk about as we go through this process that are different in the online form versus the paper. So that's coming up in a few minutes. But for the most part, it's the same. All right. So this is the paper application that you have in front of you. When you're looking at this, right here, you're going to see a stop sign. It says stop. Please make sure that you have 2 forms of ID that match the name you put on this application exactly. This is legal names. Okay, good. Some people have 4 names, and the last 2 names are hyphenated or not. Make sure that if that's you, that whatever's on your 2 forms of ID is what you put on your application, because if they can't verify it's you, you don't get to test, and they keep your money. Yeah, there are no refunds here. Down here, it's going to ask if you have Americans with ADA accommodations, like do you need a seeing eye dog or a sign language interpreter to test? Below that is your demographic information. Now, we're not going to fill this part out in class together. You can fill this part out on your own at home. I don't need to know your name, your address, your phone number, your social security. I don't need all that. So skip down here. And I want to go down to the very bottom line there. It says, do you have a high school diploma or equivalent? And I get a lot of questions on this. If you are under 18, you must have a high school diploma in order to test. If you are 18 or older, high school diploma is not required. Okay? I don't have anybody in here under 18, do I? Are you? No. You're not? Okay. All right. So this is just check yes or no. It's not going to impact you. This is just information gathering at this point. But for those of you who are attending virtual, if you are under 18, you must have a high school diploma in order to test. Now let's go down to this section. This is where it starts to get really confusing for students. So you can fill out the first demographic section on your own. You can do that. Let's go here. What this is asking is if you have, this is on page 2, if you have Do you not have it? You don't have it?
Yeah, I don't think I-
Oh, makes sense,
Oh,
'cause it was pretty double-sided.
Yep. Hold on a minute. Jake will print it for you. Do you need me to find it for you, Jake?
No, I can find it. This is packet.
Oh, there's no two.
Yeah, hold on a minute. We had to change out that first page because of the address change. So
Oh,
Jake
these
just
the second page.
Yeah.
4, 5, okay.
Jake changed those out today, but apparently they were printed double-sided, so he only printed the sorry about that, guys. Okay, so let me talk to you about this while he's printing that for you. And I'll explain what this is. This is Medicaid and Medicare fraud questions as a provider. So what this is asking is, did you go to work for a doctor who fraudulently billed Medicaid or Medicare for services they didn't provide? And if this happened to you, if you were an employee, there's a whole process you would have had to go through. A legal process. You would have been taken to court. You would have been charged as an accessory if you knew about it. So there are steps that they would have taken. And if it were bad enough, they would have put you on a list that keeps you from working in healthcare forever. And that's called Excluded Individuals and Entities List. Good? Make sense? Now, I bring that up because we have had 2 doctors in our community recently who were convicted of Medicare and Medicaid fraudulent billing. So this is very real in our community. This could have happened. So if that is you, if you worked for a doctor that was doing that, and you were found guilty, and you had to go to court, and you were put on a list and notified that you're being put on this list, that's what these questions are about. Now, that probably doesn't apply to most of you. Good? Now, I want to talk about questions 1 and 2 real quick before we get to 3, 4, and 5, because 3, 4, and 5 are about what I just talked about. But 1 and 2 are asking, have you been convicted of a felony, but not just any felony? It gives you chapters. Okay, so chapter 409, chapter 817, chapter 893. So if you have a felony in your background, see me after class. If you have no felonies in your background, check no for number 1. If you have no felonies in your background, check no for number 1. Do not check off A, B, C, D, or E. Leave those blank. We only check those if we checked yes up here. We didn't check yes up here. We ignore those. Good? Good? If you have a felony in your background, see me after class. If you have no felonies in your background, check no for number 2 as well. You're going to turn the page and skip A and B. 3, 4, and 5 have to do with that Medicare fraud I just talked about. So if that doesn't apply to you, check no for 3, 4, and 5. Leave all of the A's, B's, C's, D's blank. Do not check those off. So go to page 3. So if you have no felonies in your background, you should have no for number 1. A, B, C, D, and E is blank. Didn't check anything off. You should have no for number 2. A and B are blank. You should have no for number 3, number 4, and number 5. Any questions? I know this is very, very complex. Anybody have any questions? Okay, so, oops, let me go back. Yep. So below that is a section on disciplinary history. Do you guys see that? What this is asking is, have you ever been a healthcare provider in Florida or anywhere else and had action taken against you? So were you a CNA in Indiana, knocked around a couple old people, and they took your CNA certification away? So this is disciplinary action against a medical certification in Florida or anywhere else. If you've never had a medical certification anywhere, the answer is no, all the way down. Questions? If you have had a medical certification, you need to read and answer all those questions. Now let's go down to the hardest question on here, criminal history. This is hands down the hardest question. It's asking, do you have a criminal history? And there's only 2 choices, yes or no. Pick one. Do you have a criminal history? Now below that, it's going to ask if you've ever had any records sealed. The other word is expunged. You paid a lawyer $5,000 to make this disappear. Yeah, we're still going to find it. Still going to find it. Because in healthcare, records don't ever completely disappear. I don't care what that lawyer told you. He wanted your money. We're going to find it. You have to declare it here. The last question there is, do you have a juvie record? So a juvenile record, a delinquency record. So check yes or no. Oops. All right, so now we're going to go up to page 4. Everybody on page 4? I am not allowed to help you with this page. Legally, I cannot provide any input on this page. When you go home tonight, I want you to read each one of these questions and answer them honestly. You have to understand that healthcare is a stressful job. It's stressful. And if you already have mental health difficulties, this may not be the right workplace environment for you. And that's what this is going to ask, is about your mental health and your stability and your ability to deal with stressful situations. At the bottom here is your Social Security number. You can put that in there at home. You do need a Social Security number to test. Now, let's go to page 5. Now, I've already filled this part out for you. At the top of page 5, you've got this section that says certification option eligibility. I've already checked off E3 Challenger. If you're doing the online application, make sure, absolutely sure, that you check off E3 Challenger. I know you're in a classroom, but we are not a 120-hour program with clinicals. You do not qualify for E1 or E2. Wrong type of class. Almost 90% of all people in Florida that test under E3. Okay, so you need to make sure that you are checking E3. Now, below that, it's asking for training information, but it says we only fill this out if we checked off E1 or E2. Did we check those off? No, so we get to ignore this section, which is why you have a big X in it. We're going to ignore that section. Now we're going to go down a little bit further to our test site information. And we have 2 options here, but for us, we are going to test at a regional test site. Regional test site. And I've already checked that off for you because we don't do testing in this room. I share it with Julie. She does CPR. I can't do testing in this room. It wouldn't work. We're not set up for it. Okay. So now we have to tell the application where we want to go test. So if you go to the very back of this packet, the very last page, you are going to see a listing of all testing sites in Florida. I have highlighted the ones that are nearest to us. These are the ones that you see on Prometric's website. This is what they look like, but they're all over the place. There's no organization at all to them. So I organize them for you on this sheet into regions. You'll see North Florida, Central Florida, and South Florida. We are in Central Florida. So you want to pick one that's highlighted in the Central Florida area. Those are the ones that are closest to us. There's one in Ocala. There's 3 in Tampa. The one that most of my students test at is Agilus in Central Florida. So we're going to go right here. Right there, Agilus. Yeah, that's the one that's closest to us. The other ones in Tampa are over by USF, Busch Gardens area. And then there's one way over in like Temple Terrace. So this is the one on Waters. It's just off the parkway north of the airport. So it's not too terribly far. It's like maybe 30 minutes from here. It's not bad at all if you go the parkway. So if you're filling out this paper application, if you look at that Agilus, right next to it, it says there's a code there. It says TAMAIR. So you would put the code for the testing center you want to test at in this box right here. This box. You're going to put the test site code in this box. Yep, that page. You're on the right page. Below the big X. Test site information says regional. Off to the side. Yep, TAMAIR. Okay, remember I said that there's 3 places that the online application's a little different than the paper. So far, everything's been exactly the same. This is where it gets a little different. If you're doing the online application, you don't have to put the code in. There's a drop-down box that lists all of the testing centers. Just find the one that says Agilus. Click. Okay, good. Questions? All right, now we're going to get to what type of test do we want to take. And yes, you have choices. First, you need to understand that there's 2 different types of tests. There's the written test and there's the skills test. First-time testers take both on the same day. If you fail one of them, you have to come back and retest, but you're only going to retest that portion. So if you fail the written, you're going to have to come back and retake just the written. If you fail the skills, you're going to have to come back and take just the skills. Good? So all of those options are listed here. You have both skills and written. You have written only and you have skills only. Both of those options are listed here. Now, as first-time testers, we're going to choose one of the first 2. Except if Spanish is your native language, you may want to, maybe, I don't know, take the written test in Spanish. There is an option for that here. Clinical skills always in English. You only have one option there. But for most people, one of these first 2 is what we're going to choose. They both cost the same, $155. What's the difference between them? Well, the first one's a plain Jane test. It's the test that everybody takes. It's all the same. The second one, when you're taking the written test on the computer, they give you earphones and the computer reads the test question and answer choices to you. This is helpful. If English is not your first language, choose audio. It'll help you. If you have a reading disability or attention deficit, then that might be helpful to you. So the first option is just you reading the questions on the test on the computer. The second option has the computer reading the questions out loud to you. So choose one of those two. And then once you make that choice, whatever choice it is that you want to make, right? Whatever that choice is, the fee is $155. So you're going to write that in that total column, $155. That's how much you have to pay to be able to test.
That's the option number one.
Number one is the
155, and that'll be the same day.
both sections, same day.
Because I have some friends that they take, the written test first, and then they wait about 2 weeks or 3 to take the second one. I thought that was the way to do it.
That should not have happened.
This is great. I don't want to wait.
Yeah, I don't know why that happened in that particular manner. I have no idea. But that should not happen because first-time testers take both sections same day. Questions so far?
Well, the same thing that I asked you, I think you're not in the dates yet, right? About the dates.
I'm going to explain that in a minute.
Okay.
All right, so if we go to page 6, so we're done on page 5, let's go to page 6. At the top, it has a question, and it's asking you to check a yes or no box. What that's asking you is if you have received and read the privacy policy for testing. So that's these 2 pages in your packet. So you need to check the yes box here that says you have received those 2 pages. So you're going to check that yes box. I know you received it because I printed it for you. Actually, Jake did. We'll give Jake a round of applause in a minute. Okay, below that is your attestation. You read those statements, you sign, and you date here. Now let's go down to the bottom. The bottom says, oops. The bottom says, if you do not receive your emailed ATT letter, this is authorization to test. That's what ATT means. If you don't receive that within 10 to 14 business days from the time you submit your application, you need to contact Prometric. I cannot overstate this. If 3 weeks have gone by and you do not have your test date, you need to get on the phone with Prometric. Something went wrong. But when you call Prometric, the person that answers the phone, their whole job is to get you off the phone. They are going to say things like, it can take up to 90 days. What does your application say? 10 to 14 business days. And you're going to read that directly to them. And then you're going to ask for a supervisor. Okay. They are giving you a stock answer that does not have anything to do with CNA testing. And you have to understand that Prometric is a testing company that does not just do CNA testing. They test real estate. They test construction. They test IT. They test all different kinds of industries, not just CNA. So they're giving you an answer that applies to a different industry, not ours. Ours is very specific. So don't listen to them. Ask for a supervisor. Good. Now let's talk about the test date itself. Nowhere on this application did you have a place to put what date you want to test. You apply for the test. You wait. You will get another email from Prometric. Looks just like that one. Same boxes. Except instead of saying pending approval, it's going to say approved. That means that Prometric sent your stuff to the Board of Nursing. The Board of Nursing approved you, sent it back to Prometric. You are approved to test. You still don't have your test date. You just found out you're approved. It takes 2 or 3 more days for you to get another email from Prometric that says, okay, now we've got you a test date. This is your location. This is your test date. They assign it. They do not take suggestions. You don't get to reserve a day. You apply for the test, you get approved, you get scheduled. Now, if that date doesn't work for you, you don't have transportation, you don't have childcare, it's a family holiday, you're on a cruise ship, whatever the case may be, you just call up Prometric and you say, that date doesn't work for me. You don't tell them why. Just say, that date does not work for me. You don't need to know why. I need to reschedule. Now, if you reschedule as soon as you find out when your test date is, there's no charge because they're assigning you a date. You didn't get to pick it. If you wait until 2 days before your test date, they're going to tell you, you're going to pay us for that privilege, and they're going to charge you like $30 to reschedule. So you need to stay on top of your emails. Every day, check your emails. And as soon as you get your test date, make sure it's one that's going to work for you. And if not, call right then. Does that answer your question? Okay. You're welcome. Yep. So there's a process in place for that. Okay. Now I told you there's 3 differences between the written test application and the online application. We've already gone over one. Test site, there is no code to put in. You just use the drop-down menu and choose your test site location you want to go to. Okay, so you would choose a Gillis. The second difference with the online application, this is where you find information on how to contact Prometric on their website. The second way that the online is different, so the first is you get this drop-down menu, so you choose the site you want to go to. The second one that's different is we have a payment screen for paying for the online, okay? In your packet, page 7 is your payment page. That's where you would write all your payment stuff. But online, they approach this a little different. You still have a payment screen, like you're going to check credit card, and then you're going to tell them what kind of credit card. You're going to put your credit card number in, your name, your expiration date. And then down here, there's a little box that everybody misses. You have to check this box that says, I authorize. It's not enough just to put your stuff in there. You have to specifically authorize it. And if you submit your application and you did not check that box, the whole thing stops. It doesn't go anywhere. And you don't get a warning. Like normally the page will say, hey, you missed something. It doesn't. You will think you submitted and you didn't. So pay very close attention to this. Okay, good. All right. And then you've got this at the bottom that just makes me crazy. You don't have this on the written application. You have it on the online application. It says supporting documents. How are you going to send supporting documents? It doesn't tell you what supporting documents are. It doesn't tell you why you have to submit them. This is confusing to everybody. And I'm going to tell you, it doesn't matter. Check a box. It's required. Check a box. Now, what this is, though, if you have a criminal history and they contact you to say, hey, we want more information, tell me more. Give me your court records. What this is asking is, how are you going to send them that information? Are you sending it by mail or are you sending it by fax? For the majority of people, this doesn't even apply to us. Check a box. Got it? But if you don't check a box, your application doesn't get submitted. Now, down here at the bottom, we have the most confusing part of the application. We have save, submit, and cancel. Cancel erases everything. Submit submits everything. This is our problem right here, save. Because most people will click save because, you know, they want to save a copy in their file. Good. The problem is that when you hit save, well, you submit it, it erased your payment information. Everything else stayed, but your payment information got erased. So, because the form can't save your payment information. So, but it didn't tell you that. You just hit save and then you came right over here and you did exactly what you said. You hit submit and now it submits with no payment. So we end up with, you remember that paper I passed around with the boxes? That's when it says incomplete. Application status, incomplete. Because you hit save and then you hit submit. You didn't scroll up to see that your payment information was erased.
We just have to press submit and that's it.
Just press submit. It automatically saves it in your profile. Don't hit save, just hit submit. That's why I give you the paper application, because for most people it is easier. We've got it in front of us. We've already filled it out. Just send it. It does take longer to process, though. It will take about a week to 2 weeks longer. Yeah, I know there's a trade-off here. If you do the online application, like we've talked about, okay, exactly the same as the paper with those 3 differences that I talked about. If you do the online application now, this weekend, go do your background check today, go do your application tomorrow. If you do that, you will be testing a week or 2 after graduation. If you mail in your paper application, you will be testing 3 to 4 weeks after graduation. So you kind of have to figure out which is going to work better for you.
A week or 2 after graduation.
Now, let me give a caveat to that because I just realized that we're into May now. Let me give a caveat to that. May and June, actually April, May, and June are the busiest testing months for Prometric. All of the college courses are graduating. They all have to test right now. All of the high school programs are graduating. They all have to test before graduation. All of the technical schools are testing now. So this is the busy season for Prometric, which means that your testing window might be a little bit longer just because they have to get all of these people tested in such a short period of time.
And what about by July? You know, if it's
I have no control over their,
no,
yeah.
I mean, July is not that busy.
July is less busy. Yeah, July is less busy. So April, May, and June, those are the really busy months for Prometric. And it's just because everybody is graduating at the same time. Okay. Yeah, you just kind of picked a bad time. It's okay. You still will test. It just may take a week or 2 longer for them to get you into a testing center around all those other people. I mean, testing volume literally doubles this time of year. And they've only got so many evaluators. Yeah, they've only got so many evaluators. All right. So here's our 4 steps. Remember this from the very beginning. Step 1 was to do our background check. Step 2 was to complete the registration, which we just did. Step 3 is to get approved for testing, so we're waiting. We're just waiting, but we're checking our spam folders and our emails. We're checking our promotion folders and our emails every single day. Multiple times a day would be good. That way you can address anything that shows up. And then after you get approved for testing, then you'll get your test date. And we've already talked about the testing process. So remember, this is the process. The Board of Nursing reviews your packet. Once they approve you, they send that notification to Prometric. Prometric tells you, hey, you're approved. Good job. We don't have your test date yet. Please hold. They schedule your test date, send you another email. Says, hey, now you got a test date. Good job. And then you go take the test. So when you're working with Prometric, you're going to get an email that says, we got your application. We're processing it. Make sure it says application status complete. Then you'll get another email from Prometric, probably about a week later. It says, hey, Board of Nursing approved you. Good job. Then 2 or 3 days later, you'll get another email from Prometric that says, here's your test date. So altogether, you're going to get a minimum of 3 emails from Prometric. Good? Got it? All right. And then your test date usually is about 7 days after you get your notification. They don't give you a lot of notice here. So they'll tell you like on June 4th that you're testing on June 9th. Not a lot of notice. Homework over the weekend. You have chapters 5 and 6. Pay attention to 5. It's on dementia. We work with a lot of dementia patients. You need to know how to work with dementia patients. Chapter 6 is on skills. We cover skills in class. Read the paragraphs between the skills. And if there's ever a discrepancy between the yellow book and me, listen to me, not the yellow book. Okay? Good? Good? All right. You're going to get your after class wrap-up emails that go over all of this information. And in this email is a link to the online test video that I did. I actually did the whole online application on screen. Watch that video. I walk you through what to put where the whole way down. So I lead you through this. Okay, and you're going to get that link in the wrap-up email. It's also on our replay page, flcnatraining.com. Class 4, you'll see a link right there. So you just go to that page, click that link, and the video will play. I've got it in a million places for you. We also have your review sheets. Jake? Thank you. We have your review sheets for today, and we will see you on Monday for class 5. Remember, we're half done now. Starting next week, you'll get a little bit of practice time built into each class period from this point forward. Okay? Not today, but
Question. The payment form, if I want to just send money over. Am I sending this whole package?
whole packet.
Because the address here is different from.
No, on the front page. Yeah, use the address on the front page, not that last page. Yeah. Yep. I have to change that out too. Sorry. Yeah, when they changed their address, I wasn't aware of it. So I've got to change that page in the packet. All right. Those of you who joined us virtually, thank you so much for tuning in. Pay attention to our social media channels. I'm hoping to start posting question of the day posts on social media sometime this weekend. And I'll probably be putting about 3 questions a day up to start. So it'd be a great way for you to practice for the written exam. So we'll see you soon. Next class Monday. Until then, happy caregiving. Bye.